I'm working as a Secretary of Local Government, Youth Parliament, Punjab Cabinet. Listener people, welcome to the International Veterinary Conference on Small Animals and Birds. This is initiated by the Chief of Staff, East Wilson Animal Hospital, Sir Dr. Ejaz Rashid Saab. He is working in United States of America, and our collaborative partner is Veterinary Sciences Society. Especially thanks to Ma'am Anila that she facilitate us to organize this with Sir Dr. Ejaz Saab. Firstly, I would like to invite Hafiz Salman for the recitation of Holy Quran. Hafiz Salman, are you here?
Assalamu alaikum. Sorry, sir, we are skipping the part of recitation.
No, I can do it. No problem. I can do it. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد صدق الله مالك الملك ذو الجلال والإكرام العظيم جزاك الله. This is my request that please members recite Durud Ibrahim one time. Allahumma salli ala Muhammad wa ala ali Muhammad wa salli ala Ibrahim Majid. Allahumma barik ala Muhammad wa ala ali Muhammad wa barakta ala Ibrahim wa ala ali Ibrahim innaka Hamidum Majid. Bismillahir Rahmanir Rahim. A great welcome speech sets the tone of the conference. It makes everyone feel welcome and creates the appropriate environment for the exchange of knowledge. Let me call Chief Organizer of this program, Sir Dr. Ejaz. Please give a welcome speech. Thank you.
Thank you, Maraj. Assalamu alaikum to everyone. Welcome to this International Veterinary Conference. I highly appreciate in this conference, we have guests all over the world, some from India, some from China, some from Canada, some from USA. Everywhere we have guests on this one. We have supposed to like a 500 participate. Still we're waiting for the other one. I'm especially thankful all the speakers. We have highly qualified speakers in this conference. First speaker is my teacher, professor, well-known. Everybody know him, Professor Dr. Mazhar Iqbal. Is a name, very reputed name in the surgeon in veterinary medicine in Pakistan. I'm glad we have in this conference. And also Professor Dr. Anila Durrani, she's very good with internal medicine. And we have my classmate, Dr. Hamad, Colonel Hamad, has very good experience, a lot of experience with the small animal. And we also have like a Professor Dr. Faz Qamar, is a principal, Chung Veterinary College. And we also have a Professor Dr. Mazhar Ejaz, who is a Dean, Cholistan Veterinary University. Let me tell you one thing, why we arranged this conference. The only single objective to give a knowledge to the students, practitioners, who working in Pakistan and all other country also. This is a very good platform to learn something new, okay? And in this conference, our motivation is only one, to give a proper training to the students and give a good hand training also sometime. And I hope you will enjoy this conference. And the objective of this conference only to create a well environmental between the students in the Pakistan different university also. And let me explain you about this conference. The first speaker we have Professor Dr. Mazhar Iqbal. He will deliver a very good lecture on bone plating. Please stay with us. And after the lecture, he will ask like 3 questions. First question, when he asks, I will tell the student raise their hand and answer the question. If the student did not answer the correct answer, the negative point go to that university also. Please. Okay, please student raise your hand, name your university name, any year. This is only for the student, not for any practice veterinarian who are joining this conference. This competition is in between only for student, and there's nothing go to the university. This is just like a game, okay? And I like to every student listen very carefully. The answer, the question and answer should be in the presentation. And also, I will ask one question, just like a board related, like navally. And in this way, student have some idea how the question is coming in the board in USA navally. Because a lot of students, they also request me, sir, how the category, how the question is coming in the board also. I will explain one question. I will ask one question. There is no negative point of that question because that's not in the presentation. But whoever raised the hand is go the positive point on that university also. This is a very good, healthy competition. Please, I'm telling all the students, if you have book, you have pencil, note your pencil book, an important point. If you want, keep remember everything. Please do not raise the hand if you're not sure about the question, because that negative point impact on your university also. So my request, all the students, please listen carefully. You will be happy, you will be enjoy this conference, and you will get some knowledge. That's why we give this quiz competition also. And lastly, I want to say thank you everyone who are joining this conference. And let's start with the conference. I want to give to the Miraj to introduce our first speaker. Thank you and have a wonderful day.
Thank you very much, sir. Thank you, sir. Thank you very much. Professor Dr. Mazhar Iqbal, he is full grade professor of surgery. He got different distinctions in surgery. He had a lot of experience internationally in clinical medicine and surgery. Leading name amongst animal scientists. And the blessing thing is that I am student of him. He talked about bone plating in animals. Welcome, sir. We are great to find you here. Please carry on from here. Thank you.
Hey, hello, Assalamu alaikum.
Sir, Mazhar.
Yes, please.
Please, sir.
Thank you very much. Grateful to Dr. Ejaz Rashid, who has given me a chance to talk to you. Well, because due to limitation of time, because it's only 25 minutes, I'll be speaking only on bone plating, which is a method used for, fracture repair, Well, before we start with the bone plating, we must know that is the objectives of fracture healing or fracture immobilization is that we have to stick to the basic principles of fracture repair, which are laid down by the Association for the Study of Internal Fixation of Fractures, or ASIF. They are total 4 principles, and if we don't restrict or we don't abide by these principles, we are going to get a failure. They are the number 1 is restoring the anatomical relationship between the fracture fragments, then providing absolute or relative stability, 3rd, preservation of blood supply, and 4, early and safe mobilization of the patient. They are the 4 basic principles in order to get good healing process after we repair a fracture. Now, the second point which I will like to emphasize upon is that we have to neutralize all the forces acting on the fracture site. They are the compressive forces, bending forces, torsional forces, and the tensile forces. The process of bone healing cannot start unless we neutralize or counteract all these forces. However, the bone plate, when properly applied, is such a procedure which will neutralize all the forces acting on this fracture site. As far as the equipments needed are concerned, I have given you the list. it is being displayed on the screen. We need the plates, bone holding forceps, drill bits, load guide, tap sleeve, countersink, plate benders, and some cortical and cancellous screws. Of course, the drill machine, drill sleeve, depth gauge to see the how long screw we need for that bone, from near cortex to the fore cortex, bone taps, and screwdrivers. Of course, now I will show you the diagrams. Now, this is the minimum list of the equipments which we will need for bone plating. As far as the bone plates are concerned, we have different, sizes of the bone plates, starting from 2 mm up to 4.5 mm broad or staggered hole plates. They are shown on the screen. Normally, in the dogs and cats, we are using 3.5. Sometimes very small animals, 2.5 mm, 2.7 mm, plates, 3.5, and in large breed dogs, we can use 4.5 broad webbed plates, which are known as the staggered hole plates. Now, apart from that, there are a whole lot, whole range of plates which we can use. They are the cuttable plates, semi-tubular plates, bridge plates to maintain the length of the bone. Some the recon plates are the reconstruction plates, and the condylar plates, which you can see on the right side of your screen. But due to limitation of time, I will be restricting myself only to simple bone plating processes. Otherwise, all these, the condylar plates and the reconstitution plates, or reconstruction plates, they are normally used nowadays when we are dealing with the fractures. Nowadays, also we have the LCDCP, that is low contact or limited contact dynamic compression plates, in which you will see some ridges and troughs, and only the ridges, they come in contact with the bone, and for that there is a less stress on the cortex of the bone, or on the substance of the bone. So they are also now very popular plates nowadays, which are known as the limited contact DCP or LCDCP. Then again, we have some T plates, the acetabular plates, which you can see it on your screen. They are also being used in this one. However, we will today we will just talk about only the plates for the long bone fractures, which we can apply on the shafts of the bone. Now, naturally, apart from the plates, we will have the screws. And basically, we have two types of the screws, the cortical screws and the cancellous screws. Cortical screws, they have very fine threads along their shaft, and they are designed to anchor in the cortical bone or the compact bone. These screws may be self-tapping screws or non-self-tapping screws. These are some of the diagrams of the self-tapping screws. You can see, that on the self-tapping screws, in the tip, you will see 3 or 4 lutes, which will cut their threads by themselves, and we don't need a bone tap for them. As against, in the olden days, really we have been using the non-self-tapping screws, which you can see over here. They have a just rounded end, and they cannot cut their own threads through the bones. So nowadays, actually, we are only using the self-tapping screws, so that we don't have to tap the bone, or we don't have to make threads in the bones for the insertion of the screws. These are, the 2 screws which are showing you the different, parts of a screw, which we have to think that what is the thread pitch of the screw, what is the core of the screw. In a 4.5 mm screw, which we normally are using, in the dogs or in the other animals as well, the thread to thread diameter, that is 4.5 mm, and the part of the screw which is on which the threads are made, that is known as the core of the screw. In 4.5 mm screw, the core is only 3 mm. It means that the thread pitch is 1.5 mm. That 1.5 mm threads will go into the substance of the bone to anchor it properly. The diameter of the head is about 8 millimeters, and in the head there is a hexagonal recess, which is 3.5 mm for the tightening of the screw. So these are, the specifications are different parts for which we have to think that how much threads should go into the substance of the bone to give a proper anchorage or proper holding in the bone. So this is just you can say table showing us that is what is the diameter of the thread and what is the thread pitch and what is the diameter of the core. So in 2.7 mm screw, the thread diameter, of course, it should be 2.7, whereas thread pitch is 1 and the diameter of the core is 1.7. So 1.7 plus 1 is equal to 2.7. So it means that the threads of the screw, they will penetrate into the substance of the bone only for 1 mm. So they are again available in different lengths. Similarly, 3.5 mm screw, it has a thread pitch of 1.25 and the diameter of the core is 2.25. And in 4.5 mm screw, the thread pitch is 1.5 and the core diameter is 3. So we can see that as the size of the screw increases, the thread pitch will also increase so that they have a good anchorage in the substance of the bone or in the cortex or the of the bone or in the cancellous bone. On the other type of the screws which we are using, they are the cancellous screws. That they tend to have some coarser threads, and they are usually having a smooth unthreaded portion, which is the shaft, which allows it to act as a lag screw. I'll talk to you later. That is what we mean by a lag screw. These coarser threads, they are designed to anchor in the cancellous or the spongy bone, as against the cortical screw, which are designed to have a good anchorage in the cortical bone. These screws may also be self-tapping or non-self-tapping. You can see this diagram of the screws. They are the, on the left side, you will see the left, self-tapping screws in which you can see some grooves or lutes at the tip of the screw, whereas on the right side, the screw is just round and it cannot tap itself. It cannot make its own way into the bone. We have to tap the bone with the bone tap in such cases. But as I told you before, we are nowadays using only the self-tapping screws. The other specifications are the same. This is a very good, you can say a good diagram, which is showing you the unthreaded portion is the shaft of the screw. The threads, that is the thread diameter. It is a 6.5 mm cancellous screw, so the thread diameter is 6.5. The core on which the threads are made, that is the only the 3 mm, where it means that the thread pitch will be 3.5 millimeter, so that that is the thread will go into the bone, into the cancellous bone for about 3.5 millimeters. The shaft is only 4.5 mm, whereas the head of the screw is 8 mm, and in the center, there is the space for the screw, which is 3.5 mm. So these are very good, these are the cancellous screws. You can see the threads of the screws, they are quite sharp, they are coarse, and they have a thread pitch of 3.5 mm. So they will anchor really very well in the cancellous bone when we are using it in the proper way. These are the non-self-tapping cancellous screws, in which you can also see, this is the shaft, the core of the thread, the core and the thread pitch. That is again the head is 8 mm, shaft is 4 mm, core is 3 mm, and thread pitch is 3.5, as you have seen in the last slide as well. These are again some of the diagrams which you can see. They are the non-self-tapping screw and the self-tapping screw. The cancellous screws, actually, they may be partially threaded, they may be fully threaded, as you can see on the top. They may be only 16 mm thread, they may be 32 mm thread, they may be fully threaded. So they are used according to the situation you are dealing with. We can always select the proper screw according to the fracture or type of the fracture we are dealing with. Here also, another table which will show you if you have a 6.5 mm cancellous screw, The core diameter is 3 and the diameter of the shaft is 4.5. It means that the thread pitch will be 3.5, as you have seen in the last slide as well. Now, these are some of the other equipments which we have to use in the bone plating. One is the plate benders, as you have seen it in the in that list, because sometimes we have to bend the plates according to the contour of the bone. Such as the best example is the humerus. Humerus has a specific contour, and we cannot place a plate on it which is very straight. We have to bend the plate according to the contour of the bone. So these are the plate benders by which we can bend the plate easily. These are the bone clamps, different bone clamps. They are available. The low man's bone clamp, the other bone clamps. Any bone clamp that can be used according to the situation you are in. This is our for fracture reduction forceps. It is really a very good forceps in which after reduction of the fracture, the ends of the jaws of this fracture reduction forceps, they are very sharp. They are very much pointed, and they just go into the substance of the bone. And then after reduction of the fracture, you will note that these ends they will go into the bone, and they will not allow the bone fragments to again displace. As you can see in this diagram, it is you can apply to reduction forceps, and you can reduce the bone, and after reduction of the bone, you can just apply a plate on it. Similarly, over here, this is how we can also reduce. That is, you can compress one end of the bone with the reduction forceps, and the reduction is proper. Reduction means that you bring the broken ends of the fracture fragments into alignment, or into their near anatomical position. These are the drill machines, which may be battery operated, hand driven, electric operated, but nowadays we are using battery operated machines, and they are quite good. You can just charge your battery. You can have 2 batteries at the same time, and you can go even for 1 hour or 2 hours with those batteries. Absolutely. This is a very good instrument. It's a load guide which is used for central and eccentric drilling. If you see on the right side, the ends, and one is on the top that shows you the central drilling. That when we drill hole or a hole in the bone, it will go right in the center of the plate hole. Whereas down you can see the eccentric drilling, that is on the other side of the load guide, which we use for eccentric drilling. That is we drill the bone only on the far side or far edge of the plate hole, so that we can compress it when we tighten the screw. Because in the DCP, maybe I have not told you, in the DCP are dynamic compression plates actually. So the holes, they are oval holes and they are gliding holes. So when we fix the screw in it and then we tighten it up, the screw will glide on the on the plate. It will go towards the inclined portion, and thereby it will also pull the bone along with that, and thereby we can reduce the gap between the bones or between the fracture fragments. These are the drill bits, 3.2 mm. Drill bits. They are also 2.7 mm. That I will show you in the next table. When it comes, that is where we use these drill bits, and if we are using a 4.5 mm screw, which size drill bit we should be using. That I will give you a guide like that. This is the depth gauge. They are very, very again important instrument. For that, we must know what size of screw we need, from the near cortex to the far cortex. So with the depth gauge, we can just see it goes on the far cortex. It has a hook on one side, so it will stick there. And on top of that, we can see, as you can see in this diagram, it is up to 30 mm. It means that we will need 30 mm screw going from the near cortex to the far cortex along with the plate. So it's this instrument is a must, which every practitioner should have. This is a drill slave, a tissue protractor. This must be used when we are drilling the bone, because there are soft tissues around the bone as well. So if we don't use this drill sleeve or tissue protector, the soft tissues, they will be wound around the drill bit, and they will be very badly damaged and they will not heal properly. So we must have this drill sleeve, and our drill bit will go through this sleeve and the soft tissues will be saved on the sides. This is a bone tap which we use for making threads in the bone, in case we are using the non-self-tapping bone screws. On the right side, it's a 4.5 mm cortex bone. On the left side, you will see the 6.5 mm cancellous bone tap. However, we will be using this bone tap only when we are using non-self-tapping screws. But as I told you before, we are nowadays using self-tapping screws, so we really don't need these bone taps in all the cases. Is a countersink, just to remove some bone, in the near cortex, so that the head of the screw, it sinks in the bone and it does not irritate the soft tissues. That we normally use when we are doing the interfragmental compression. These are, just simple screwdriver with 3.5 mm hexagonal screwdriver, which we will use for 4.5 mm screw. Now we go to the bone plating procedure. Now, basically, we have two options, ideas or two main concerns when we are doing the bone plating. One is the axial compression, and the other is the interfragmental compression. We have to do these in order to get good results. Axial compression is used in fixation of transverse fractures, as we will see, in the next slide. And the interfragmental compression is used in fixation of spiral or oblique fractures of the shaft of the long bones. Now, in this case, though, this is again a very good table for you. In this one, we'll see that if the diameter of the screw and what if suppose we have 4.5 mm cortical screw, which you can see on the right side of the scale. So for that, we'll use the drill bit 3.2 mm, because if we use the same size drill, the screw will be very loose. So the diameter of the drill bit should be definitely smaller than the diameter of the screw itself. So this is a general, international, you can say specifications that 4.5 mm cortical screw, you will be using 3.2 mm drill bit. The bone tap, if you want to use, that should be 4.5 again, and the screwdriver will be 3.5. Similarly, for the cancellous screw, if it is 6.5 mm, the drill bit is used 3.2, or you can also use 3.6 drill bit. Bone tap is 6.5 again cancellous. If you want to use it, if you are not having the self-tapping screw, then you will have to use the bone tap. And screwdriver is 3.5 mm, with the hexagonal in the head of the screw. So let us now see how we will achieve the axial compression when we use 4.5 mm cortex screw. Now, first of all, what we do is that, we always apply plate on the tension side of the bone. A tension of the, we have to drill the, with 4.5 mm screw, we will drill the bone with 3.2 mm, which will go from the tension side or near cortex up to the forecortex, and we drill it about 1 centimeter away from the fracture line. Then we hold the plate against the bone with its hole opposing the drill hole in the bone, and estimate the length of the screw with the depth gauge. Okay, so after that, what you okay, as you can see it over here, that is when you use the depth gauge. Depth gauge is, it is going from the near cortex to far cortex. This is the hook which is sticking there, and by the on top of that, you can see how long screw will use along with the bone plate. And this is the screw insertion. When you insert the screw, it should the tip of the screw, it should go beyond the forecortex, otherwise the screw will not hold properly. Then we will tap the threads in the screw if you are using the non-self tapping screws, and then drive the screw until its head just touches the plate. We will not tighten this screw in the first hand. Then we reduce the fracture, hold the bone with the bone holding forceps so that the plate is aligned parallel to the long axis of the bone. Okay. Then we translocate the plate to cause the screw head to engage the whole of the plate at its far edge away from the fracture site. Translocate means we move the plate towards the other side so that the head of the screw touches the far end of the plate, so that when we tighten the screw will glide towards the fracture site, and along with it, it will also take the bone towards the fracture line, which will reduce the gap between the fracture ends. Now you will drill the other fracture fragment through the plate hole nearest to the fracture site using 1 mm load guide. Load guide, that is eccentric drilling. So this hole is drilled using the yellow load guide. One end is yellow, the other end is green, with the arrow of the guide pointed towards the fracture site. As you can see in this diagram, this is the eccentric drilling. This one over here, because so that when our screw we tighten up, it is a gliding hole. So the screw will move towards this side, and it will also take the bone along with it to reduce the gap from there. So this is very important, because since the load guide contains an eccentrically placed hole that will allow the screw to compress the fracture fragment bone by translocation of the plate. So then we estimate the length of the screw, tap the threads in case of non-self tapping screws, drive the second screw, now remove the bone clamp, and then tighten the screw, followed by tightening of the first screw. So these two screws, they are the most important screws, and after that there is no problem. Then you can just do the neutral drilling. As you can see it over here, this shows that it is you can see it is an eccentric drilling. You can see the head of the screw, it is just touching the far head of the bone plate, okay, or the whole of the plate. So when we actually tighten it up, the screw will glide towards the center. As you can see the arrow, and the screw, it will come in the center, and it will also take the bone fragment towards the fracture line. So this one also, because it is translocated, it will also press to this side. So you can see down the arrows, that is, this screw will be pressing the bone fragment to this side, this is to this side, and this gap between the fractured ends, that will be completely gone. And this is what we want for the interfragment, this for the axial compression, because we don't want any hole or any space or any gap between the fracture ends. So philosophy behind axial compression is then that is because the screws are placed eccentrically, tightening will press the conical heads of the screw down against the edge of the spherical gliding hole of the plate, thus forcing the fracture fragments together. The remaining holes on both sides, then they are done in the normal way, where the neutral drilling, and the screws are placed and tightened the same way. Now, if we want to get interfragmental compression, that is in case of spiral fractures or oblique fractures, that is also done, because when we want to apply a plate, we also want to compress the fracture site or fracture fragments. This procedure involves placement of one or two screws or one or more screws across a fracture site, so that fracture fragments are opposed and compressed together. I will show you some diagrams which we did over here that will explain whole of the procedure. So this is achieved by using a screw in the lag effect. Lag effect means that then the threads of the screw take hold only in the fore cortex, so that when the fracture fragments are pulled together, the screw, when tightened, the fracture fragments will pull together. That is, the screw will not have any holding or any purchase in the near cortex. So the purpose is to achieve either by using cancellous screw or a cortical screw and the lag effect. Now, if we want to use a 6.5 mm cortical cancellous screw, that will be very easy, because the shaft is 4.5 only. So we reduce the fracture fragment and drill the near and far cortex either with 3.2 or 3.6 mm drill bit. Then we over drill the near cortex with 4.5 mm drill bit. Or if you remember, our when we are using cancellous screws, the shaft diameter is 4.5. So we over drill the near cortex with 4.5. Then we measure the length of the screw to be used with the depth gauge. After that, we can tap the cortex if you are using non-self-tapping screws. Then we will drive the screw and tighten it. The screw will take hold only in the forecortex, and it will pull the fracture fragment together when we tighten the screw. And if we want to have the procedure for interfragmental compression using 4.5 mm cortical screw, that is in the lag effect. So then we drill the near cortex with 4.5 mm drill bit using a 4.5 mm tap sleeve. Then we insert a drill sleeve with an external diameter of 4.5 mm and internal diameter of 3.2 mm into the hole till it meets the forecortex. Then we drill the forecortex with 3.2 mm drill bit because we want to have anchorage only in the forecortex, because the diameter of the screw is 4.5. So when we drill the near cortex with 4.5 mm drill bit, it will have no holding in the near cortex. It will have only in the forecortex. So when we tighten it up, the fracture fragments will come together. This is that is the insert drill sleeve, which has an external diameter of 4.5 and internal diameter of 3.2, which we use for drilling purposes. So then we take out the drill sleeve and measure the length of the screw with the depth gauge. Tap the forecortex with 4.5 mm if you are using non-self-tapping screw. Cut the countersink in the near cortex. Countersink with the we make a space for the sinking of the head of the of the screw so that it does not irritate the soft tissues around it. So then we drive the screw and tighten it up. As the screw will take hold only in the forecortex, it will result in the interfragmental compression when tightened. As you can see, the beautiful note is that if the obliquity of the fracture line is going from tension to the compression side, the interfragmental compression can be achieved through a plate holes. Because we always apply the plate on the tension side of the bone. So if the fracture line is going from the tension to the compression side, otherwise, if it is going the other way, then we have to compress the fracture fragments beforehand, before the application of the plate, which we then apply as a neutralizing plate. As you can see in this diagram, this is the oblique fracture, and your drill hole should be almost at a right angle to the fracture line. Okay, so here you can see this is we are drilling it. Now this is the drill sleeve, which is having the outer diameter of 4.5, internal diameter of 3.2, and this is the drill bit going down. And after that, you will see the depth of the screw with the depth gauge. Then you can tap it if you have the non-self-tapping screw, and then you put the screw inside. This is a cortical screw actually, which is being used in the lag effect. Now you will see that because this screw has only holding in the forecortex, near cortex has no holding because it has been drilled the same diameter as the diameter of the screw, that is 4.5 mm. So when we tighten it up, it will pull the fracture fragment down fracture fragment upward, so it will reduce the gap between these two. So this is also, you can say, if you are using the plate on the tension side of the bone, you can go through the plate hole, and if the procedure is the same. That is, you can see this central drilling. This is the eccentric drilling then, and then you can have the bone plate, interfragmental compression like that. It is also showing the this is showing with the cortical screw, and this is for the cancellous screw, because on both sides there will be no purchase or no holding of the shaft of the screw. In the near cortex, it will have only holding in the forecortex. So when you tighten it up, the gap will be reduced. This is again a table showing you that is it is same, that you will use the near cortex with 4.5, the forecortex with 3.2, and then you can have the compression at the fracture site, as you can see it over here. Now I will show you these two diagrams. This was a camel cough, which was having a short oblique fracture. You can see it over here on the right side. On the here there are no overriding fracture, so which I did with the bone plate. But because it was a oblique fracture a little bit, so I did the interfragmental compression as I just explained, and then on top of that I applied the neutralizing plate, as you can see it over here. Now this is the screw which is giving us the interfragmental compression, and you can now hardly appreciate the fracture line. And then a long plate, it was applied in a neutralizing fashion, because after you do the interfragmental compression, you can actually see that here all the fracture line has disappeared almost. And after interfragmental compression, naturally we cannot use the axial compression, so we have to make the plate, apply the plate in a neutralizing fashion, and this healed very very beautiful. There was a very beautiful healing on this fracture. The other case, it was a very interesting case. You can see it's a almost spiral oblique fracture of the tibia. It was a Rottweiler dog. It was done by some practitioner. However, what happened, he used the intramedullary pin along with the some cerclage wires, but because it was a very hyper dog, but you can see what happened. The plate bent and the fracture, it collapsed. It just collapsed though, and you can see these orthopedic wires. They also have been displaced. So it was brought to our hospital in the at Rifa College of Veterinary Sciences. So what we did, we removed this pin with very difficulty by cutting the pin over here at the fracture side. We removed both the pin, and then we applied a plate on it. Again, those fracture fragments, they were compressed before with the interfragmental compression screw, and after that, we applied a plate on it, and now this this procedure helped the dog too much. And this is the same dog. This is the same dog, which is the Rottweiler is a very hyper dog, and he's you see he's bearing the weight on all the four limbs. So these are the two very interesting cases which I wanted to tell you, that this is how we can go around the problem. So with this, I know we end with this presentation. And now I think I should, as Dr. Rashid has told me, we have to give 3 questions. Or so should I ask the questions now?
Yes,
Doctor?
sir. Yes.
Okay. So my first question is that to get interfragmental compression in the long oblique fracture with the 4.5 mm screw, which size drill bit you will use in the near cortex? So please raise your hands.
Student, raise your hand, and Miraj, unmute their speaker, okay? Only speak on the mic.
Okay, sir.
Yes, please. Did you understand my question?
There's one. Can you unmute his speaker?
Yes, sir, I did.
Okay, should I ask the question again?
Yes, sir, please.
Yes, please.
Well, if we want to get interfragmental compression in a long oblique fracture with the 4.5 mm cortical screw, which drill size or drill bit size we will use in the near cortex?
Sir, I think it will be 3.2.
No, please.
Who answered this question, Miraj?
Sir, Abdurrahman, someone.
Abdurrahman. Please name your university also. Who's the second one? Abrar Ahmed. Can you unmute? Please name their university first, okay? Name and Can you unmute like Abrar Ahmed?
I am unable to see his name, sir. Here.
By here I see that. Let me unmute.
Okay, sir.
Okay.
Sure, sir.
Can you unmute?
Yes, please. It means you have not listened to me properly.
Abrar Ahmed. Okay. Miraj, can you unmute the Abrar Ahmed? And the next is like a
I'm unable to see his name here.
Pardon?
yeah, the Abrar Ahmed. You can unmute his.
Assalamu alaikum, sir.
Who's
Wa
this?
alaikum
Sir, we will use 4.5 mm's screw because drill bit, sorry, for interfragmental compression.
Yes,
Abrar
very
Ahmed,
good.
please,
Yes.
which university you belong?
Right.
Sir, from Rifa
Okay.
College of Veterinary Sciences.
Okay. Okay. Next question, sir. The
Next
point go to the
question.
Rafa University.
Okay. The next question
Thank you,
is,
sir.
Please do not, sir, do not raise your hand. Raise your hand after the question. Okay.
the next question is that in a DCP or dynamic compression plate, how the plate holes help to get axial compression. Should I repeat the question? That is, in a transverse fracture of a long bone, how the plate holes in DCP help to get the axial compression.
Miraj, can you unmute like a Muhammad Mujahid?
Yes, sir, I did. I did, sir, I did.
Okay.
Assalamu alaikum.
Please name your
Walaikum
university
salam.
first. Okay. Name your university.
From Bhutan University, I
Which-
will answer that question. We
Which
can
university?
get axial compression by eccentric drilling.
Which university you are?
Rifa University.
Okay. Okay, sir.
Okay, yeah, that's okay. But it actually, it is due to the gliding hole. Because with the gliding hole, you will have the screw head going down, taking the fracture along with that. Okay, third question, should I ask now?
Yes. Yes.
Okay, what are the different dimensions of the cancellous screw? If the cancellous screw is 6.5 mm, what are the different dimensions of the core, the thread pitch, and the shaft of the bone, or shaft of the screw, sorry. That is, you are using a 6.5 mm cancellous screw. What is the size of the shaft of the screw? What is the size of the core of the screw? And what is the size of the thread pitch?
Okay. Can you unmute the?
Please speak. Yes, sir, I did. Shamshad Farid, please speak, bro.
Yes, sir. Assalamu alaikum, sir. I am Shimshadri from UVAS Narwal campus. And then core will be 3.5. And sorry, sir. Core will be 3 mm and thread pitch will be 3.5 mm and shaft will be 4 mm.
Very good, very good. That's right. Correct, 100% correct. Yes.
Good.
Yes.
This point go to the Narwal campus, UVAS. This go to the UVAS. Okay.
Yes, sir. From UVAS Narwal campus.
No problem. You got your point. Okay.
Thank
Third,
Thank you, sir.
I think you. Sorry,
Okay.
You're done with third question, am I right?
Yeah, yes, please. Yeah. Okay. Now you can ask any question.
No, sir, I'm very glad. I'm very happy. Let me ask one question from. Okay. Can you read this question? It's the same thing like a coming like a Navally board questions. You guys scan the question with your eyes. Nobody can read the question there. And just answer. There's 4, 5 options you guys have. Okay. Maraj, can you unmute the first one?
Sure, sir.
Did you unmute the first one?
I did, sir.
Go ahead.
GG
Yes,
sir, this is Asadullah Quraish from Sindh Agriculture University, Tandujam.
Hello. Assalamualaikum. Excuse me. I want to answer.
GG Walaikum Salam. Sir, this is Asadullah Quraish.
Yes, we got it.
I'm here.
GG sir, it's Asadullah Quraish from Sindh Agriculture University, Tandujam, or I think it's का जो perennial adenoma ये option correct है 4.
चले ठीक है आपका नेगेटिव पॉइंट है जब नीचे चले जाएं आप okay, next, can you get the next one?
Yes, sir.
Assalamualaikum. I'm Dr. Mujahid from Punjab University. The answer is number 5, that is chronic adenocarcinoma.
Okay, okay, who's the next one? This is a negative also. Rufa University is not negative, is no point, okay?
No point, no.
Can you unmute the next one?
Sure, sir. Let me see. There is no one, I think so.
Okay.
Are you getting something?
Because in this question, if you look the history and everything, if you look the blood work, they say hypercalcemia and hypercalcemia and the sublumbar lymph node swelling going on. Okay. Most of the time, when you have the calcium value high in the blood work, we think about the cancer. One of the cancer is called like a lymphoma. Is very common cancer in the pet and the dog, but you cannot see the option here. They are second. The most common second one is like an anal sac adenocarcinoma. These are most common cancer. When you see the calcium value high, then you have to check the patient anal gland also. Most of the time we see with the carcinoma. Otherwise, we see like a calcium value is high with the food also, they're taking more food. But the examiner, they give you option. In this option, the best question answer is anal sac adenocarcinoma. If anybody has any other thing, that's my, let me. Okay. Let's go for the second speaker. Maraj, can you?
Miss Faiza Iqbal, please carry on from here. Introduce your society.
This is Fiza Iqbal from DVM third year, UVAS. Without any further delay, let me introduce Vet Christian Society. Vet Christian Society is a non-profitable animal welfare organization. We see a slogan, "We treat those who can't speak," says all about the society. We urge ourselves and everyone around to make sure that these speechless creatures are dealt in the best possible manner. I would like to welcome Professor Dr. Anila Zamir Dorani, is a professor in the field of veterinary medicine at a University of Veterinary and Animal Sciences in Lahore, Pakistan. Dr. Anila Zamir Dorani is a respected academic and professional in the field of veterinary medicine. As a professor, she likely plays a significant role in the teaching and conducting research in the field of veterinary medicine. Her research and academic work may encompass a wide range of topics related to animal health and diseases, nutrition, and other aspects of veterinary sciences. Please, ma'am, unmute yourself and start your lecture. Thank you.
Professor Dr. Neela Dhroni, are you here? Maraj, can you check the madam is here?
Sure, sir. Yes, sir, she is here.
Okay. Madam, you hear me?
Please, yes.
Yes,
Please
I
make
can
her as
hear.
the co-host.
Yeah, Assalamu alaikum. I can hear you. I was unmuted now, but I can't share my video because the host has stopped it. So I will just go without video now.
That's okay. That's fine.
No, ma'am, please wait. Sir, kindly make her as a co-host if you can.
I make the co-host already. Hold on 1 second.
Ma'am Marilla, please raise your hand, please.
I make the co-host already. Hold on 1 second. Yeah, I make the co-host.
Can I share my screen because
Yeah, sure.
The message says that host disabled participant screen sharing.
No. I make you co-host.
Yes,
right.
ma'am, you are now co-host.
All right. Am I visible?
Yes, I think the slide is not coming yet. I think you click the start screen sharing. Yes, go ahead.
So, am I good to go now?
Yes, go ahead.
Thank you.
Yes, ma'am.
I am Professor Dr. Anila, and I work as a professor in the Department of Veterinary Medicine, University of Veterinary and Animal Sciences, Lahore. I'm going to talk about the national surveillance policy that is mostly in connection with the pet practice in Pakistan. Still, we do not have any policy, but again, there are some points that I need to discuss with regard to policy initiatives in Pakistan. All of us know that there are many zoonotic diseases in human beings, and if we talk about the pet animals, leptospirosis, brucellosis, rabies, toxocariasis are important zoonotic diseases. And as far as seroprevalence of human toxocariasis is concerned, its antibody titers vary depending upon the geographical locations, economic status, dietary habits, lifestyle, and level of awareness of the people. Therefore, it is important for the government to establish national surveillance program for diseases like toxocariasis, so that would aid in the development of targeted intervention strategies, and that is very important and need of the hour. I will also throw some light on the Health Research Institute in Pakistan and its objectives under which this institute is working. Now, toxocariasis, I'll just briefly throw some light on points that are very important from the global point of view as well. It is a neglected parasitic zoonosis, and it affects millions of pediatric and adolescent population worldwide. Seen mostly in the poor countries and communities, the disease is caused by the infection of Toxocara larvae. And this Toxocara canis and Toxocara cati are mostly abundant intestinal parasites of dogs and cats. Over the past many decades, we have come across many documentations that has increased our understanding of biology and epidemiology of toxocariasis. Toxocariasis has 4 forms: visceral, ocular, covert, and neural. And incorrect or misdiagnosis of any of these disabling conditions can result in severe health consequences and considerable medical care spendings. So fortunately, multiple diagnostic modalities are available, which are, if effectively used together with the administration of appropriate therapies, then we can minimize many unnecessary patient morbidities. Although progress has been made in the management of toxocariasis patient, but we need to work on the implementation of new strategies like new diagnostic biomarkers, which may increase diagnostic accuracy and better understanding of pathogenesis of this spreading problem throughout the world. There are many challenges that are seen globally, like lack of laboratory infrastructure in some countries, lack of uniform case definitions, and limited surveillance infrastructure. We are also facing similar challenges. And for higher education institutions, clinical research breakthroughs are very important that will help in the control and prevention of this disease. This slide shows the symptoms and the risk factors described for the clinical toxocariasis in humans. And this disease itself is being reported from almost 100 countries now. CDC has made it in the list of 5 most important diseases worldwide. And we humans, mostly, we acquire this infection after ingestion of embryonated eggs that are present in the soil or contaminated food, or by the ingestion of encapsulated toxocara larva that is present in the improperly cooked tissues of paratenic hosts like cows, sheep, and chicken. And following ingestion, the embryonated eggs, they hatch in the small intestine, penetrate the intestinal wall, they gain access to the circulation, then they migrate inside the body, and they lead to inflammatory reactions and clinical symptoms that vary according to the organ involved. And although the infection in the humans is there, and humans act as the dead end host, or the humans are considered as the accidental or aberrant host, where toxocara larvae cannot develop into adult worm. But at the same time, this parasite has notorious tendency to being extra-intestinal. In this slide as well, we can see that visceral larval migraine and ocular larval migraine and neural larval migraine, they have different signs, and mostly consumption of raw meat, consumption of infected snails, or consumption of contaminated vegetables that lead to this disease. And these are important risk factors. Due to the non-specific symptoms of the disease and its medical and public health impact might be underestimated. This is another problem at the national level, and mostly the disease is diagnosed on the basis of patient symptoms. But lab diagnosis is required to improve the accuracy of diagnosis. This table shows the level of toxocara antibodies in the selected countries, and this is the data from CDC from past many years, and it is now summarized in this form. National seroprevalence of toxocariasis is highest in USA, followed by Denmark, then by Japan, and then by Pakistan. But regional seroprevalence has different picture, and it shows that highest anti-toxocara antibody levels are seen in Brazil, followed by Indonesia, then USA, then Turkey, and then Pakistan, and then it is followed by the figures in Japan. As I have earlier told you, that the highest number of this disease is reported from almost 100 countries now, and it is among the 5 most important neglected parasitic diseases in the world, as claimed by CDC. We can see ocular toxocariasis all around the world, mostly in Europe, Asia, Australia, and Latin America. Similarly, lesser number of neural toxocariasis cases are also detected from different countries worldwide. And in our subcontinent, the visceral toxocariasis is mostly detected. Again, there are different risk factors, but in our subcontinent, contaminated soil and contaminated vegetables are the major source of infection to the human. Now, the next disease is rabies. Rabies is endemic in Pakistan. I'm not going to go into detail of rabies, but we in Pakistan, dog bite cases are mostly reported, and they're mostly attached with the occurrence of rabies disease in human beings. Although no data on the human rabies cases is available at the national level in Pakistan, but the data has also shown that 2,000 to 5,000 people die of rabies every year. Human rabies is not a notifiable disease in Pakistan, and there is also no nationally coordinated response to the disease and its surveillance. In the past, globally, stress was given to the management of dog bite and rabies with the introduction of newer vaccines. But despite all this, overall treatment cost was very high, especially in case of Pakistan. But in the past few years, the strategy has been changed to the vaccination of pet and stray dogs and cats now. And let's see in the years to come, what will the figures of rabies cases in Pakistan. This is a small survey of dog bite cases at the national level, and you can see that largest number of cases were reported from Karachi, followed by Peshawar, and then Hyderabad. And the category of wounds was also different. 40% of patients had category 1, that is less severe bites, and then category 2, and lastly 31.9% had category 3 or more severe wounds, as the data says. This this slide shows the spatial mapping of dog bite cases in Karachi, and you can see very well that the areas that are marked in dark brown color, they are more cases of dog bite reports from these cases, these areas, but all the other parts, the Karachi dog bite cases are being reported. And another shocking thing is that the studies have also shows that the organ transplant is another risk factor for the transmission of rabies in the recipients, and deaths were also reported from the recipients who had organs from the donors who were infected with rabies. So this is another area in which higher education institutions or research institutes need to work on in order to detect how many cases of rabies are connected with the organ transplant. Although we have transplantation of human organs and tissue bill 2007, and illegal organ donation is now curbed at the national level. This is another cross-sectional study on rabies in Islamabad, and it has shown a different picture of the rabies. Study was done in December 2019, and male to female ratio was 2:1. It was mostly seen in the age group of 22 to 30 and 31. And the single anatomical location was mostly documented in 78% of cases, while 51 had category 2 wounds. Real-time dog bite surveillance proved to be effective for recording and management of dog bite cases. But we should also keep in mind that rabies is not only transmitted by dog bite cases, because it is the disease that is present in all the warm-blooded animals. So there must be the other risk factors that are prevailing in Pakistan that need to be studied. Another CAP survey was carried out in KPK, and that also shows the majority of juvenile population less than 18 years was mostly not aware of the clinical signs of the rabies. 75% of respondents were not vaccinated. 60% did not even seek doctor advice after suspected animal bite. 55% had inadequate healthcare facility for rabies in their local area hospitals. Respondents that had pets at home had not vaccinated themselves against rabies, and then awareness of pre-exposure prophylaxis for rabies was also very less. There were also respondents who did not visit the doctors after suspected bite as well. So the data was very clear that 69% were unaware of the rabies vaccination, 65% had rabies victims in their families or among their friends. Then 54% of cases have already have inadequate health facilities or hospitals in their areas. Another 54% were unaware of the clinical signs of the rabies. 38% were unvaccinated against rabies. 51% were unaware of the rabies exposure, and 52% did not visited doctors after rabies bite. So the careless attitudes and practices mostly revolves around inadequate healthcare facilities, not visiting the doctor, rabies victim in the near or extended family that is not mostly reported, and unvaccinated pets in the households. So these risk factors, there are many other risk factors that are associated with the socioeconomic status and feeding habits and climate as well. Individuals with the soil-related occupation were mostly involved, and they were all suffering from the rabies, according to seroprevalence studies, as compared to the people who were not engaged in the agriculture industry. The concerns in the rabies and way forward, health regulatory organizations should develop effective control plan for treatment of rabies. Vaccination shortage must be handled environmentally. Government need to design a proper strategy that has strong and substantial capacity to reduce the onset of rabies. Poor sanitation is the primary cause, and lack of awareness, vaccine hesitancy, knowledge gap. These are the actually points that increase the risk of the rabies. And of course, as I previously said, that illegal organ transplant must also be looked into. Third disease is borreliosis in dogs. This was the first report. Lyme disease is first reported through a PhD study by one of my students. And borreliosis is a multisystemic zoonotic disease in dogs. And in our study, we detected in Lahore 4.3% cases in dogs, and on the ticks that were present on the dogs, 8.7% were affected. Rhephicephalus sanguinis and Ixodes gibbosus were investigated, and in this study, Ixodes was the gibbosus was the first time reported tick in our study, mostly present on the inner side of the hind limbs, so they are not detected, and they rest safe in the inner side of the hind limbs. Age was another factor, and male dogs more than 30 kg, 1 to 7 years of age, were highly affected with the disease. And as we see the species of these dogs, so bulldogs were prevalence was high. Then came the greyhounds, and then the Rottweilers. So outdoor housing, travel history, feeding practice, hygiene had positive relationship with the onset of borreliosis. And the species of Borrelia that we detected in our study was Borrelia burgdorferi sensolotto 16S RNA. So then ultimately we are heading toward the One Health approach, and WHO, OIE, FAO, they collaborated under One Health initiative to eradicate canine rabies transmission to humans by 2030, but there was not any talk about other zoonotic diseases. These three organizations, they framed a global framework for elimination of dog-mediated human rabies that focuses on the rabies elimination by adopting socio-cultural, technical, organization, political, and resource framework that is called as the Stop R framework. The strategy to implement this goal revolves around increasing the awareness on the rabies, and then strengthening the human and animal surveillance system. That is very important, because without it, we cannot eliminate such diseases. Then we need to encourage the regional and national collaborations, emphasize regional government involvement, and sponsor the policies and practices to implement the elimination strategies. We have National Health Survey of Pakistan, and this organization was developed to provide accurate health statistics to the government of Pakistan for proper planning and policy development in the health sector. The objectives of this organization was to provide a general health profile of the people of Pakistan with special reference to regions, to urban or rural setting, national estimates of major diseases, overall health status, disabilities, and health behavior, but there was no talk on the zoonotic diseases from the pet animals. Then the second objective is to provide health profile of high risk group, including children under 5 years of age, married women of reproductive age, and elderly 60 years of age and above. Then the third objective is to assess the utilization of health services, drugs, and traditional medicine by the general public. And the fourth is to provide these data in a form that is relevant to the health program, policy, and planning needs to the government of Pakistan. So we can clearly see there was a missing link of the zoonotic diseases, especially that were transmitted through pets. A conceptual basis of disease surveillance is possible with the public and private partnership that starts with identifying economic and political parameters. We identify problems and assess needs. Then we set priorities. We look for alternative approaches. We plan interventions, implement them, assess their impact, and assess the health of the animals. So there are this picture also shows that public-private partnership is very important for disease surveillance. And this gap also needs to be looked into. The control strategies must involve public awareness, prophylaxis, serodiagnosis, adequate healthcare facilities that we may be lacking, treatment and prevention of pets and people, and development of targeted intervention strategies that still we need to see in the years to come. So why we need policy? Because communicable disease challenges the health system, human health system. Surveillance system for human communicable diseases are implemented at the national level, and surveillance of animal infection started later, but it is mostly focused on the livestock production later on because of the zoonotic diseases like avian influenza and West Nile virus infection. Novel surveillance system is established for wildlife only. Although pet-borne infection infection system notifications are there, but this also only focuses on the rabies and it ignores the other diseases. Pets, domesticated dogs and cats that live in the close proximity to humans are a risk of many diseases to the owner's health and other people's health, except especially the occupational hazards for the veterinarians. They can also serve as sentinels for several diseases, and these features emphasize the need for a surveillance system of pet infectious diseases, especially those that can be transmitted to humans. So we have in our today's conference, Dr. Hamad from the private sector with us, and I would like to request from this forum that let's work on development of pet policy, national pet policy for Pakistan. Pet disease surveillance policy is required because in Pakistan, as in other countries, pet infectious diseases like rabies have not been included in any of the surveillance system. We need to start a pilot surveillance system that may motivate other investigations regarding zoonotic infections of pets in Pakistan, and that is also possible with the private sector. The resulting information will be helpful to provide the data in development of these policies. And as globally we are heading toward the IT-based solutions, so we in Pakistan must also develop our own IT-based solutions for surveillance in pet practice. And last but not the least, higher education institutions must work on the neglected diseases in their research, and applied research must be done in this area. So this was my last slide. I just focused my presentation on the policy initiative, and I just wanted to give a message to the students that this is another area that we need to think about, and you being potential professionals of veterinary sector in the years to come, you must also read about these documentations that are mostly concerned with the policies initiatives, especially with the livestock sector, and more focused on the pet diseases. Thank you so much.
Madam, can you ask like your 3 questions step by step? And also, Miraj, before Madam, please, can somebody write on the name and point and everything? One from the Rafa University and one from the UVAS University student, okay? Please write on the name. You can nominate any person from Rafa University, and I will like to nominate as any person from the UVAS University also.
Sure, sir, sure.
So I'm not going to ask questions on the figures, but I would like, my first question is on number 1. What are the 4 forms of human toxocariasis?
Please raise your hand, student. Can you unmute like a doctor? First one.
Yes, sir, sure, I did.
Assalamu alaikum, ma'am.
Yes.
Yes, ma'am. Visceral.
Please, please name your
visceral,
name and name your university first.
Sir, I am a graduate of Refa College of Veterinary Sciences.
Okay.
Yes, ma'am. Ma'am,
Yes.
yes, ma'am. Ma'am, first one is visceral. Visceral. Second one is ocular, and last one is neural.
Very good.
Yes, you are right. Thank you. Okay, my second question is, what is the name of pathogen that is responsible for causing borreliosis?
Please raise your hand, okay? Raj, can you unmute the first one?
I'm doing, sir. Tanveer Ahmad, please unmute yourself. Yes, Kabir Ali, please speak.
Borrelia Dorfrey.
Please name hold on. Name your university first, okay?
Tanveer Ahmed, IUB, sir. From IUB. Tanveer Ahmed from IUB.
UVAS?
IUB, sir.
Okay.
IUB, sir.
Islamia University, Bahawalpur.
Okay.
Yes.
Okay.
Yes, thank you, Tanveer, you are right. And my third question and my last question is that why we need pet policy?
Marai, can you unmute the first one?
Sure, sir. Dr. Jansi, please unmute yourself. Good.
Yes, ma'am.
Yes, my question is why we need pet policy?
Ma'am, we need pet policy because many of the zoonotic infections from the pet are spreading to the people who are catering those pets. So there is no data of pets diseases which are transmitted to the pet holders or the one who has pet animals.
Okay. Yes, partly it is true, and also there is some economic impact of these diseases in our country as well. You are right. Thank you so much.
Yes,
I just wanted to add 2 more words into your vocabulary. One is if anybody can answer that is a bonus question. What do you understand by spill over and spill back? Do you have any idea on that?
No, ma'am, you are asking me?
No, I am asking all the participants. You have given your answer. You have given your answer. You are right.
Where are you from, Dr. Jahanzir?
It's a bonus question.
So he's from.
It was not in my presentation.
Tanvir Ahmed, please speak.
It is a bonus question.
Ma'am, can you repeat question?
Yes. What do you mean by spill over and spill back? Especially when we are talking about the diseases. So I just give
ma'am,
I just
think
give you. Yes.
ma'am, tell me.
Okay, I'll give you the answer to this question. It was not included in your quiz. It was a bonus question. Spill over is actually the the diseases that are transmitted from animals to humans, and spill back is the terminology that we use in the diseases when this situation is reversed. So instead of using zoonotic, now the modern terminologies are spill over and spill back. Thank you so much.
Thank you, Professor Anila Durrani. This is very important topic, and in USA, we have huge industry on this one, billion and billion dollar. We are spending on this one, especially for to control the zoonotic diseases. And one thing that let me ask the student, okay, the Toxocara canis, that's called like a roundworm. It's very common disease in the USA. And how the puppy, like a 1 week puppy, they can get the infection. Because the puppy also get like infection with the Toxocara canis, like a roundworm, even if it's a 1 week old, 2 week old, 3 week old, through the milking. Through the milk, the larva is also coming, okay. And it's very infectious disease. It can cause the human also, like they can lose the vision also, okay. It's very bad disease. And we have it controlled very well, but still we see a lot of cases. Right now we have like a PCR test for the fecal test. Any puppy coming like in our clinic, like a first visit, we check their fecal sample, sent to the lab like a PCR test, and they will give us all the detail if they have any parasite, anything, okay. Okay, let's go for the Navli questions. Let me see. Okay, can you guys scan these questions and answer? We have 4 options right now. Whoever like to answer, please raise your hand. In board question, you have only 1 minute every question, and you have to scan like a very fast. You have to answer within 1 minute. So you have to do the practice also, because there's a 60 questions and they give like a 55 minute. Is less than 1 minute, I think, time. And there's a few questions in every section. There's 8 section, 8-hour test. In every section, there's a few questions. They are no number, no point, nothing. They are just checking. It's very easy question, okay? No one know the answer?
Yes, please, Shamshad, unmute yourself.
Yeah. Yeah, unmute yourself. First one. Mraj, can you unmute the first one?
I'm doing again and again. Yes. Asadullah, please speak.
Give to the second one.
Assalamu alaikum, sir. जी sir, it's B option. Option number 2, fully disclose in situation with client and client out of protocol in place to prevent reoccurrence. I think behavior likely change of dog. I think 2 option.
Do you understand the question? Where are you from? Hello? Your answer is right, okay. Where are you from?
Let me unmute him again. Please unmute yourself, Asadullah Korejo.
I think
Yes,
this is from
please speak.
Cholistan University. I'm right?
Sir, from Sindh Agriculture University.
No, sir,
Tandojam.
he's from Sindh Agriculture University.
From Sindh Agriculture University.
I wrote down, sir.
Sindh Agriculture University.
Yes.
This point code to the Sindh Agriculture University. Please write on the name of the student, because when you send the certificate, they get a special certificate also, the winner, okay? So please write the name,
Yes, sir,
and the
I am
university
writing.
name. Very important.
Yes, sir. I am writing.
Yes, sir.
Your
Yes.
answer is very right, okay? Because this is the question, very tricky question. The examiner, they want to know their brain reading, okay? That how honest you are, because the dog escaped, and they give the other option also. They like to cheat you, okay? But you have to very honest with the client. If the dog escaped, you have to tell the owner, yes, the dog escaped, but we bring him. And to prevent the reoccurrence, they have to put the bar like a first bar, and they have to put the second chain also, okay? So dog, if they jump from the first wall, they can have the second wall also. So these are the boarding place. There we have new rule and regulation in USA. If you have a kennel boarding, when you have like outside walking, you have to make like a 2 wall, like a first wall and second wall. Suppose the dog jumped from the one wall, you have a second wall also to catch the dog, okay? So there's the answer. Answer number 2 is very right. And I think let's go for the next speaker. Maraj, I think next speaker is my classmate, Dr. Rimad.
Let me introduce Sir Dr. Madha Hashmi Saab. He's Lieutenant Colonel Dr. Hashmi, retired. He's a renowned veterinarian who graduated in 1989 as a DVM from College of Veterinary Sciences, Lahore. Now it is known as UVAS. He joined the Army in 1991. He remained in active service till July of 2016, where he served on various commands, instructional and staff appointments. He has the honor of serving and commanding the Army Dog Center. He is also a member of World Veterinary Association, and he is former associate member of Australian Veterinary Association. Please, thank you very much. You are here for us. You can continue now. Thank you very much, sir.
Bismillahirrahmanirrahim. Am I audible?
Yes.
Yeah.
Yes, you are, sir. Yes.
As he has already mentioned about me, I'm Dr. Hamad Ahmed Hashmi. Beside my other qualification, I am CPD certified in pet nutrition and pet psychology. Currently, I'm working as General Manager, Companion Group, SNAM Pharma. Before I start my presentation, I want to share this slide with you that in 2021, in July, my chapter was published in this book named Emerging Challenges for Food Production and Security in Asia, Middle East, and Africa. The chapter is of 43 pages, and it is titled Impact of Climate Change on Livestock and Related Food Security Implications. Overview of the situation in Pakistan and policy recommendations. The chapter was published by Springer, and so far there have been 602 downloads of my chapter and 2 citations internationally. Let's start with the topic. The topic for today's forum is pet health management and vaccination guidelines. First of all, we will discuss few things, how to keep your pets healthy. There are some important points like balanced and healthy diet, regular vaccination and their subsequent annual boosters, grooming, routine deworming, biosecurity, and if you have a kennel facility or you are running a private hospital or a clinic, this selection of manpower is very important. Then 5 things every pet needs to feel good: that freedom from hunger and thirst. All dogs, cats, and other pets should have easy access to water and food. Freedom from discomfort, from pain, injury, disease. Freedom to express normal behavior. There should not be any distress, and they should not be fearful. And there are certain do's and don'ts for pets. Do research about the pet foods and do not overfeed your pet. Do give your pet plenty of water and don't bathe them too often. Use supplements wherever they are required. And the pets must be treated for fleas and ticks. And the pets must also be given regular exercises. Now we come to the one of the most important aspect in our practice. It is the pest vaccination. How do we define the vaccination? It is the act of introducing a vaccine into the body to produce immunity to a specific disease, whereas the immunization denotes a process by which a person becomes protected against a disease through a vaccination. And this term is often interchangeably with vaccination or inoculation. As we all know that there are 2 types of immunization. One is active immunization, second is the passive immunization. In active immunization, which normally we do, is the vaccination. It is the active immunity is the administration of antigens to actively mount an immune response. That is vaccination or natural exposure. Active immunity occurs when our own immune system is responsible for protecting us from a pathogen. How we define the passive immunization? It is the transfer of antibodies formed by an immune individual or animal where the immune individual acquired immunity. Maternal transfer of an antibody or a serum immunity. Then passive immunity occurs when one is protected from a pathogen by immunity gained from someone else. Further elaborated, the types of immunization: innate immunity, which can be non-specific or specific; adaptive immunity, it can either be active immunity or passive immunity. Among the active immunity, there are 2 types: natural or artificial. Passive is natural and artificial. While we discuss the innate immunity, it's either non-specific or it may be specific. Among the adaptive immunity, there are 2 major types. the active and passive. In the active nature, for example, poliovirus cannot infect the dogs because of the absence of specific receptors in that specific species. And artificial, for example, vaccination of the mother during pregnancy that will carry immunity from the placenta. While the passive immunity, naturally, it is produced by the vaccination, and that will also produce memory cells. And artificial is the exogenous introduction of the immunoglobulins, but they will not produce the memory cells. They will provide the immediate protection, but not the memory cells. When we talk about the characteristics of acquired immunity, it provides specificity, self non-recognition, immunological memory, and diversified. This is the slide on the view file, which gives us the features that how we can differentiate between active and passive immunity. Active immunity is achieved by the immunization of host active infection, while the passive immunity is achieved by transfer of performed antibodies from immunized individual to non-immunized one. Active participation of both host immune system. In active immunity, it is present, whereas in passive immunity, it's absent. The time lag in providing protection in active immunity takes time in production of specific antibodies and cells, but they are long-lasting. Whereas passive immunity provides instant protection, but it is short-timed, not time-lagged. Duration of protection conferred, usually for longer period of time when we induce the active immunity, whereas the passive immunity is short-timed. While giving the example of active immunization is the tetanus vaccine or anti-tetanus toxoid, whereas in passive immunity, it is the anti-tetanus serum. Now we come to the major diseases against which we carry out prophylactic vaccination in cats. Primary diseases for which we do the vaccination are the feline panleukopenia. It is also known as infectious enteritis or feline parvovirus. Then we have feline rhinotracheitis, feline leukemia virus, feline calicivirus, chlamydia fellis, and feline rabies. These are the major diseases against which we carry out prophylactic vaccinations in dogs. These include the canine distemper, infectious canine hepatitis, infectious laryngotracheitis, canine parvovirus, parainfluenza, leptospirosis, rabies, and kennel cough. So, what requirement is given by the clients or by within the society and the disease prevalence? And most important is the presence of vaccination for these major diseases. As Professor Dr. Anila has already emphasized on the importance of rabies, the CDC and the World Health Organization has declared that annually around 59,000 people are inflicted with the rabies and they die. So it is one of the major concerns for the world bodies to control rabies. Scientists have shown that once minimum 70% of dogs are vaccinated, rabies can be successfully controlled in an area and human deaths can be prevented. However, even once a sufficient level of dog vaccination is reached, rabies control efforts must remain constant and robust. An annual turnover of approximately 25% in the dog population necessitates the revaccination of millions of animals yearly. And reintroducing rabies through the transport of infected animals from outside a controlled area is always a possibility which should be control the program labs. In Europe and North America, they are using oral rabies vaccine in the jungle populations or the areas which is adjoining to their cities. They are vaccinating the red foxes and raccoon dogs with the oral rabies vaccine twice in a year. They spread these oral rabies vaccine dates through aerial route because they see the clusters of these red foxes and these raccoon dogs in those jungles where they throw these oral rabies baits twice yearly. So they control rabies by that means. In Europe, in Holland, when I asked their vets, they told me that they controlled rabies from their country by adopting all stray dogs. Because when they adopted all stray dogs, they became their primary responsibility to vaccinate and immunize them annually. So just by one law, the entire population in that country, it became immunized. Such efforts are being done in Pakistan also, but still there are many efforts we have to undertake, as Professor Dr. Anila has mentioned, that we have to make a national strategy and national policy for the pets also, where we can control these zoonotic diseases, especially the rabies. Now I will discuss shortly what are the most important aspects of successful vaccination in pets. In my opinion, the most important thing is the maintenance of cold chain. There is a specific temperature on which the vaccines have to be maintained throughout the time, till the time they are inoculated to the pets. We have to maintain asepsis. Without that, we can't achieve the ideal inoculation. Then the right route for the vaccine administration. If it is indicated to be given through subcutaneous, you can't adopt another route for it. Then health status of the pet. This is again the prime responsibility of our colleagues, veterinarians, to see first of all whether the animal is in healthy condition, whether he or she is suffering from some infection, it is febrile, or down, dumb, or something like that. You must see that before. Because if you will inject the vaccination without checking it, it will be of no use. One, you will incur a financial dent to the client. And secondly, you are not going to get any gain out of it. This is ethical also. It should not be done that this is the date when the booster is due or the annual vaccination is due. You have to go for that. Please don't do it. With this, I end my presentation.
Well, you have 3 questions.
Yes.
Okay, go ahead.
Shall anyone tell me that how many people die worldwide due to rabies?
Can you unmute the first one? Right.
Yes, sir, I'm doing. Yes.
Please. You're not audible.
Sir, 59,000 per year.
Right, thank
worldwide.
you. Yeah, this is correct.
Where are you from?
Tanveer Ahmed from Islamia University, Bahawalpur.
Okay. Marai, can you write on the name and the university name? Can you go for the second
Tanveer
question?
Ahmed from Islamia University, Bahawalpur.
We got it. Ahmad, can you stop sharing your screen and ask the second question?
All right. My second question is, what is the temperature on which we maintain the cold chain for the vaccines? I did not mention it deliberately.
Sir, 4 degrees centigrade.
No, there is a range.
Okay.
Please unmute Muhammad Hassan. Yes, please.
This is Muhammad Hassan Ali, and I am from Rifa College of Veterinary Sciences. The temperature for the maintenance of the cold chain of vaccine is 4 to 8 degrees, I think.
No, the range is a little different. The 8 degrees is correct, but the
Yes, sir.
Can you get the next person chance?
Yes, please.
Marai, can you open the next person?
I'm Bismat from UAF. The range is 2 to 8 degree.
Good, shabash. That is correct.
From the UF, am I right?
Yes, sir.
Okay, Marai, can you write on the name and the UF? Okay, the point go to the okay. Third question.
How much is the percentage which is sufficient by which we can say that now we can handle the rabies cases successfully in an area? How many dog population should be vaccinated? Only then we can be little, feel ourselves protected that now we can combat the rabies menace.
Marai, can you unmute?
So it is from UVAS Narwal and 70%.
Good.
Answer is 70%.
Okay, the point go to the Narwal University, UVAS. Okay.
UVAS.
Thank you, sir. Thank you very much.
Okay.
Thank you, sir.
I heard the Professor Dr. Akram Munir want to join, but somebody removed. I don't know who did. And please, if he join again, please do not remove. Okay. Professor Dr. Akram Munir Saab, Rafa University. Okay, Ahmad, you done with all three questions?
Yes, thank you.
Okay, thank you, Ahmad. Thank you very much, Ahmad, for your very nice presentation. And stay with us. Let's see with the one more things. Okay. Okay. Anyone know about this answer? Please raise your hand. Marai, can you unmute the first one?
Sure, sir.
This is a bonus point. There's no negative point.
Mr. Muhammad Asmatullah, please unmute yourself.
If not, give the next one chance, please. We don't have a time. Okay.
Sure. Sure, sir. Kabir Ali, please unmute yourself. Jazib Haider, please unmute yourself.
Assalamualaikum,
Yes,
sir.
please speak.
So I
Yeah.
think it is the option B.
Please go ahead. First of all, which university you are?
Sir, Rifa College of Veterinary Sciences, Lahore.
Your answer is number 2. I'm right.
Yes, sir.
Okay. Next one. Can you unmute the next one?
Muhammad Asmatullah, please unmute yourself. Okay. Aftab Muhammad, please unmute yourself. Yes, Aftab
Sir,
Ahmad.
this is Ahmad from graduated from Bifa International University. Sir, according to my knowledge, this will be the normal findings.
Where are you from? Rafa University?
Yes, sir. I am graduated from Bifa International University.
The point to
Assalamualaikum, sir.
Rafa University. Okay. There's a normal finding. This is like something like examiner. They want to cheat you also. Okay. This is very normal
Sir,
finding.
this is Asadullah.
Asadullah, please. Time is over. I know they already answered the question. The point go to the Rafa University, and this is a normal finding. This is the type of the question. Sometimes the examiner, they want to cheat you. They give you like everything fine, but they make you like something like distract your brain also, putting light and see this and this. But if you know the anatomy of the eyes of the bird, then you will answer the right way. Okay, this is a normal finding. Okay, Marai, let's go our next speaker. I think the Professor Dr. Faz Kamar Saab.
Yes, sir, please introduce him. It's up to you.
Okay. Our next speaker is like my friend, very close to me, Professor Dr. Faz Kamar. He's a principal from the Jung University, and he's doing a lot of things with IT and all these things on the pet, and a well-known name. And I hope you guys, he has very good presentation, parasitic disease of the fancy bird. And we like to see this presentation, and I don't want to waste any time. Let's over to Dr. Professor Faz Kamar, Principal, Chung University, US.
Thank you very much. Bismillahirrahmanirrahim. Am I audible, sir?
Yes, yes.
So thank you very much. First of all, I would take maybe half a minute to say thank you very much to Dr. Ejaz Rashid, my teacher, Professor Dr. Mazhar Iqbal, Professor Dr. Anila Zamir Durrani, Dr. Hamad Ahmad Hashmi, and also the upcoming faculty members. So it's a very good platform, and I really acknowledge and appreciate Dr. Ejaz Rashid. Being in US, he is doing a lot for Pakistani universities. So I congratulate you and I salute you, sir. This is number one. Number two is, sir, coming to the agenda, my topic is parasitic diseases of fancy birds. So why I took this, topic, there is a big reason behind. And this reason, if I could establish during my presentation, it would be a great era. So let me take first of all that why. In Pakistan, in the past 30 years, if I gone through, there was a boom, like the people in the poultry side, they came in, and there was a industry. Pakistan become a poultry not an individual, but it becomes an industry. And there were some people who were selling medicines, feeds, chicks, and also some equipments and all that. So it was an industry, and it is an industry, and many people, especially our graduates, they are getting jobs, and they are their own business into it. But there was another era, it was the dairy, and the people came into it, and they were spending. Then next era was the pets. The people were spending in only Lahore, if I say, there were only 4, 5, 6 pet clinics, but now they are more than 100, maybe around 150 or maybe 200. So it's a gap that the people are there. So coming towards the fancy birds, it is the era which is highly, getting into boom. Many people in Pakistan, not only in Pakistan, but also abroad, they are just getting into this business. And not only business, but they also get it as a game birds, as a fanciers, as their pet birds. So there is a huge gap, and this gap is going to be filled. I give you an example. In Pakistan, Lahore, Pakistan Medicos, on an average, it is selling 1 million Pak rupees sales every day. So it has a big setup. But once I come across that there is one person who is dealing with fancy birds, and he is also doing more than that business. I mean, he is doing 1.5 million Pak rupees business per day. So it means the business of fancy birds is getting more and more into existence. So because of this, I choose this topic, that the upcoming vets must must gain knowledge, and they must be equipped with the fancy birds, their keepings and their handlings and their management, and of course, their diseases. So coming towards that, let me introduce a bit that what these fancy birds means. So there is a list of birds and animals which can be termed as fancy birds, but I am just concising a few just for the knowledge of my graduating students. Number one is cockatiels. So the picture is here. You can just get an idea that I'm talking about what. Passeriforms. The next is columbiforms. Galliforms. In Pakistan, there are many people who are doing this. They are just crossing from one breed to another, and they are making some new breeds, and they are getting a good business. And even one cock or one hen, they are selling at a cost of 25,000 rupees and sometimes 50,000 rupees. So they are just doing this business. Then psittaciforms. These are the very common in our houses and all that. Then falconiforms. So this is very good. One of my friend is from Qatar. He was saying that there are some, they are looking for some people who are trained with falcons or eagles. So there is nobody in Pakistan who is working on the falcons or eagles. So this is a great era if you concentrate on the fancy birds, and you specialize in it, so you will get a good job, and maybe there would be no problem. Then mallards, then cockatoos, manna, toucans, canaries, finches, lorry, budgies, budgerigars. Budgerigars are parakeets. These are very small birds and very colorful. They are very abundant in Pakistan. Egret, tundra swan, trumpeter swan, Bavic swan. These are different types of swans. Mute swan. Then there is a goose, bean goose, robin. So I just limit onto it, but this list goes with the peacocks, there's the doves, and many other species of birds. Maybe some aquatic species also. They are also coming in the fancy birds and animals. So what my topic is, what I'm going to do is that I'm going to just introduce few most important illnesses or health issues which are related to pet birds. So you all know that if we talk about parasites, these could be divided into two types. Number one is ectoparasites. Number two is endoparasites. So I'm not going to go into the details of ectoparasites. It's obvious that ectoparasites are on the body and they are not, and the endoparasites means inside the body. Ectoparasites, they are mainly ticks, lice, and sometimes these flies, mosquitoes, and all these things, they are known as ectoparasites. And endoparasites, predominantly, you all know, these are the helminths and protozoans and tapeworms. So broadly speaking, we will be just overviewing all types of parasites into these various animals, various birds. So before I go into the detail of this, let me share why I have chosen this. I have this NRPU project from the HEC, and this was because of the only one reason, that now it is established that the fancy birds is getting a good market share, and this is a huge problem. So because of that, we have published this paper, comparison of in-pouch, kit, and diamond medium for Trichomonas gallini identification. So next is similarly, pathogenicity and diagnostic sensitivity of culture media for identification of Trichomonas gallini. This is my student who worked on Trichomonas gallini, and why I'm just sharing this, it is the reason that because of this topic, he has gained a scholarship, and now he is studying, he is pursuing his PhD in China, and this is fully funded scholarship onto him. His name is Ali Raza, and he is studying in University of Science and Technology, China. This is why I'm saying that, because our young people, if they are inspired and they focus on some bird, then they can get some good goals also. Similarly, we have published molecular detection of fancy birds parasites for clinical diagnosis and epidemiology review. All these things are available, and even we have published some book chapters also like this. The topic is welfare of pet birds and potential zoonosis. So if you want, you can get, I will share all these things with you people, and you can go through it and you can get knowledge out of it. So let me go into the subject. So as I mentioned earlier, that there are ectoparasites as well as endoparasites. So mites in fancy birds is very common. You can see these are the pictures of mites, and I do not go into the details, but the Dermanisis gilli is most common, which is in chicken, turkeys, pigeons, canaries, and various other birds. Then there are lices. They are also very common, and sometimes they can be seen with the naked eyes, but sometimes they do not. So sometimes they are known as nits. Nits means they are the just the larvae, you can say, are the intermediate type of, their age is not adult one, so they can be seen. So the lice are also available in various fancy birds. Then there's a worm infestation, as I mentioned earlier, that worms can be further subdivided into pinworms, roundworms, whipworms, hookworms, tapeworms, and flukes. So all types of worms, they are available. They can be present in different types of species of birds. So the most common is psittacosis. Psittacosis is a disease which shows pneumonia-like or flu-like illness, and it is because of chlamydia psittaci. So this is very common in parrots, parakeets, and other birds, and it is common throughout the world, and it is a big problem. So its symptoms are fluffed feathers, increased sleeping, or eyes closed. I do not go into the details because my interest is just to give you an overview of many diseases. So maybe you can go through it and you can learn many things out of it. Similarly, there is an overview that which type of diseases or fancy birds diseases are there. So this is a simple graph. So here is a list. I will just focus on it, and if I could establish that my audience could understand that these are the main parasitic diseases of fancy birds, so the purpose of my presentation would be over. So number one is giardiasis. Number two is trichomoniasis. Number three is sarcocystosis. Number four is hemoproteus. Number five is coccidiosis. So these number five, they are really important. Giardia, trichomonas, sarcocystus, hemoproteus, and coccidia. And the next one is ataxoplasmosis, capillariasis, eustorostrongyliosis, sarconema, uricera, amidiostomum, and epimedostomum, acanthocephaliasis, and nasal leeches. So this is the outcome. I will just brief a little bit of these diseases. Number one is giardiasis. This is most common in cocktails, and it has a direct transmission, I mean ingestion by the infective cysts. So cocktails that are they are infected with the capacious or popcorn appearance droppings. So the main symptom is its vocalization. Their voice is a big problem. How can we diagnose the fecal smear? And the zinc sulfate flotation test is used to detect the cysts of giardia. So direct smear always works. And if you want to have some more specificity, then ELISA or PCR tests are also used for the antigen-based detection from the feces. So far as its treatment is concerned, metronidazole with the dose rate of 25 to 50 milligram per kg per oral is given for 5 to 7 days. So this is a good drug, and it works well. Similarly, carnidazole with the dose of 20 to 30 milligram per kg body weight is also recommended for giardiasis. And if you see under the microscope, you will diagnose giardia like this. So second important disease, as I mentioned earlier, is trichomoniasis, and trichomoniasis is reported in almost all types of fancy birds. And its clinical symptoms are dysphagia, anorexia, dyspnea, and weight loss. And mostly there are some plugs or mucosa in the crop, oropharynx, and esophagus. There are some caseous lesions which are present in the esophagus or in the trachea. So you can see its lesions and you can see the nodules in it. Similarly, you can find lesions on the roof of the mouth. So its transmission is, it's a two-way. I mean, number one is it comes from the parents to the offspring. You can say it's a direct transmission. And second is the indirect. It means it is coming from the contaminated food and water from one bird to another. So these two routes of transmission exist in trichomoniasis. So its diagnosis is a bit tricky. Sometimes you will have to make some special, media for its growth and for its examination, because it's a flagellated organism, and sometimes it die early and we cannot go for its with the direct smear. So sometimes we go for the there is a special technique which is used for the identification of trichomoniasis. So its treatment is ronidazole, and it is given in 6 to 10 milligram per kg per day. You understand, please, all, that the doses for fancy birds are really important. If you increase the doses, sometimes there may be some toxicity or some ill effects also. So be careful, and you always try to weight the birds and then calculate the dose accordingly. Carnidazole as well as metronidazole, they are also used for the trichomoniasis. Next one is the sarcocystosis. For 1 minute, may I request Dr. Ejaz that how much time do I have? I may not take much time. Dr. Ejaz, are you here?
Yeah, I'm here. I'm here.
So can I take another 5 minutes?
Yeah, sure, sure.
Okay, thank you. Thank you. So next is sarcocystosis. Sarcocystosis is a major problem in parrots, and it causes huge mortality. And there is a depression, respiratory distress, weakness, ataxia, and anemia. So because it causes high mortality, so its postmortem is very, important. And you can find some CNS or neurological symptoms, and sometimes you can find histopathological lesions in lungs, kidney, muscles, and CNS tissues. You can find their hemorrhages, and the lung density has increased, and there are also renal lesions. So these is the, you can say muscle fibers. There is a muscle fibers, and cystosarcosis are available in the fibers and the muscles. So its treatment is trimethoprim and sulfamethoxazole in combination. This is given in 30 milligram per kg body weight 2 times a day. Similarly, pyrimethamine. You can simply say that the sulfur drugs, they are effective with against this disease. Then is Hemoproteus. Hemoproteus is again very common in cockatoos, pigeons, and other wild birds. In Pakistan, we surveyed and we noticed that this disease is very, very common. Even 70 to 80% of the pigeons, they have this disease. Sometimes this is subclinical, and sometimes it is clinical. And sometimes it heavily affects the racing pigeons. The people who are doing the gaming birds, racing pigeons or game pigeons, they are heavily affected with this disease. So the clinical symptoms, the most important is splenomegaly and hepatomegaly, and similarly pulmonary edema. So these 3 symptoms, they are very, very, common. Splenomegaly means enlarged spleen, hepatomegaly means enlarged liver, and pulmonary edema means fluid in the lungs. So if there is a high parasitemia, then a bird is, stressed or immunocompromised. So diagnosis is mostly on the basis of blood smears, and you can find the gametocytes with the encircled RBC nucleus, and treatment is not recommended if the bird is asymptomatic. However, it must be quarantined, and it must be treated for a longer period of time for the Hemoproteus, and mostly the coccidial drugs, anticoccidial drugs are also effective against the Hemoproteus. So next is our coccidiosis. So coccidiosis is a very common, and it's a managemental disease, and whenever there is a problem in the litter, so there will be a coccidiosis. So coccidia, our students, they have gone through it in poultry as well as sometimes in large animals also, but the birds are highly susceptible to it, and there are many cases, and this disease can be diagnosed on the basis of management. So it is most common in canaries and finches, also in pigeons, and the most important is enteritis. So there is blood in the feces. This is the most common, and we can get through it by direct smear or flotation, metronidazole, as well as some anticoccidial drugs like ESB3, some sulfur drugs, and they are also used for its treatment. So Up to next, these are the less common diseases, but they are also prevalent. So I will take just a little time on it. Ataxoplasmosis. So this is asymptomatic sometimes, but once the young birds or juvenile birds are most susceptible, and 80% mortality, this is caused by these, ataxoplasmosis. Its clinical signs are non-specific, maybe depression, anorexia, diarrhea. One thing I must mention over here, because once you are dealing with birds, so clinical signs sometimes they are subleading. They are confusing. So it is always recommended that you go for the lab tests and go for the fecal examinations. And once you fecal examination, you can find out some, eggs or larvae or maybe cysts. So once you find it, then you may go for the treatment, because specific diseases have a specific treatment. Sometimes it is mentioned that no problem, every type of parasitic problem must be treated with either ivermectin or with the sulfur drugs. This is not true. Many, diseases, they are very, very specific, and they do not cure if we do not give them proper treatment. So pyrazine is the drug of choice, or paramycin is the drug of choice for this problem. The next is capillariasis. Capillariasis is also common in finches, canaries, and it mostly affects digestive tract and causes, digestive problems. So its transmission is coming from the infective eggs or larvae, food contaminate. The major problem in fancy birds is their hosting, or their living, or their cages. The cages are not properly washed or cleaned, and they are not hygienic. Because of these diseases spread most of the time. So I skip all these because they are also common, but less in severity or less in epidemiology. So this is the very, very, typical disease, strongyloidosis, and it is, it causes regurgitation. And sometimes in, pigeons, this is very common. So you can find this, there is tunnels due to urostrongylosis. So you can say there is invagulation of the intestines because of this parasite. And its diagnosis is that if you find, sometimes you have to go for the x-rays, and by the x-rays you find that there is some profusions or some at the proventriculus or ventriculus region or the intestines. So then there's the sarconema. Sarconema is most common in swans and geese. So it's a filarial worm which is transmitted by a biting louse. So in it, the heart may be enlarged. It's a heart problem, and there is a muscles are embedded, and the myocarditis is mostly appearing because of this. Next is amediostomum, apomediostomum. So these are the gizzard worms. They are thread-like worms, and they are present in the gizzards, and they are mostly present in waterfowl, and also sometimes in parakeets and passerines. So these worms are, as I mentioned, they are in ducks or in swans. So their symptoms are against emaciation and young birds. So they also affect the gizzard lining and muscles. So once gizzard is not working, so the bird will not perform better. And there will be, the bird will be not performing well, weight gain will be lost. And if you keep these birds, they will not be healthy for you. They will not be productive for you in terms of egg laying as well as in the meat production. So this is a typical goose showing ulcerations in the gizzard lining, and this is because of amediostoma. The next one is acanthocephalosis. I'm sorry, sometimes the name of parasites are big one and it is difficult to recall them. But if we make a dictionary or something like, then it becomes very easy. So ducks, geese, and swans are considered to be the most commonly infected birds because of this acanthocephaliasis. And all age classes can be effective. Their grass lesions are in the intestine, and the proboxes of Acanthosophilus, because they attach to the mucosa of intestines, and the parasites they shed out, and they persist in it, but they keep on shedding from the abdominal cavity. So this is a typical symptom. Then there is the last one is the nasal leeches. These nasal leeches, they are present in the aquatic bird species like waterfowls and many other species. So they are sometimes go into the nasal cavity and the nasal passages, and they block the nasal passages, and because the nasal passages are they are unable to take proper oxygenation and all that. So, and there must be sometimes eye damage because of these temporary blindness also sometimes happens because of these. This is the type of leeches which are blood engorged, and this is removed from some swans. So these all are the major endoparasitic diseases, but sometimes there are some external diseases also, like scaly legs. So this is very common in many birds. So scaly legs is because of Nemidocoptes and Nemidocoptes mutans. So this is very common in cage birds, and the birds which do not, they are discomfort, limping, itching, reluctance to perch, and lameness. So their treatment is some sprays, ointments, and some Netex scaly leg removers. Sometimes they are treated surgically. Maybe they are like wounds, so they are treated and they're given some hygienic treatments and some ointments. So there is air sac mites. Sometimes this is very common, air sac mites, and because of it, the lungs, trachea, and respiratory tract of birds is effective, and death rate is very, very high. And if low infection, then there is, it maybe no symptoms will not appear. But the most common symptom is high voice from the lungs. If you are keeping birds for the voice purpose, so the air sac mites may be causing some problem. Ivermectin and moxidectin with the range of 0.2 milligram per kg body weight is most effective. So this is all from my presentation. Thank you very much for listening, and I hope you could grasp out of my presentation.
Sir, your three questions.
Yes, coming towards the three questions, my questions are relatively very simple. And I would say to my students that please be quick to answer these questions. You will find MCQs. So you will find 4 options out of the statement. So my first question is on the screen now. Which parasitic diseases can cause feather loss, skin irritation, and scabs in fancy birds? The options are avian pox, giardiasis, trichomoniasis, scaly leg mites.
Maraj, can you unmute the first one?
Yes, sir, doing.
Assalamu alaikum, sir. Assalamu alaikum, sir.
Yes, please go ahead.
My name is Muhammad Akib from Cholistan University of Veterinary Animal Sciences, Bahawalpur. My answer is giardiasis, B option.
I'm sorry, the answer is not correct.
Okay, next person. Then this will go to the negative point also. Maraj, can you write down the name of university and everything? Put the
Please read carefully the statement and then answer.
Yes, sir. Hassan Rashid from Gomal University, Directional, sir.
Yeah, go ahead.
Answer is D, scaly leg mite.
That's the right answer. Thank you very much.
Good, very good.
Scaly leg mites. So my next question is, which parasitic disease is caused by a protozoan and can lead to gastroenteritis issues in fancy birds?
Maraj, can you unmute the okay?
Yes, sir, I'm doing.
Sir, it's option D, coccidiosis. Me, Asadullah Korejo from Sindh Agricultural University, Tandojam.
Thank you very much. Your answer is right.
Okay. Maraj, can you write down the name and the university name also? Okay.
Yes, sir. I
So
did.
my last question is, what type of parasitic infection is caused by a species of protozoa and can lead to diarrhea and weight loss in fancy birds? The options are lice infestation, tapeworm infection, cryptosporidiasis, and feather mites.
Maraj, can you unmute?
Doing, sir.
Hassan Rashid from Government University. The right answer is tapeworm infection. Sorry.
I'm sorry, the answer is not right.
Okay. Maraj, can write the name and also the negative point. Okay. The next one.
Yes, sir. I did.
Yes, sir. Hassan Rashid from Government University. I have already answered tapeworm infection.
Yeah. Your answer is not right. Okay. You get the negative point. You can go ahead. You can. Okay. Next one.
I'm Abdul Samad from UAF. Answer is C, cryptosporidiasis.
Thank you very much. That's the right answer. The trick is you must mention the species of protozoa. So all the others, they are not protozoans. Cryptosporidiasis is the protozoa. So thank you very much. Thank you very much, sir. Dr. Ejaz Rashid. I, say once again, thank you to for organizers also. Thank you.
Doctor,
thank you very much, sir. Thank you.
Stop sharing your screen and Doctor, you just stop sharing your. Okay, thank you. Okay.
Yes, I did.
Yeah. Believe me, this is a very important presentation. I think Dr. Faz Kamar. We see a lot of fancy bird in USA, and I'm telling you the truth. I see exotic, and some people they're traveling like 1 hour, 1 hour 30 minutes because exotic doctor is very rare in USA also. I work in wildlife, I work in zoo also. That's why I have some experience. Then I work in exotic in USA also. That's why I have a little bit experience, not much experience, but still I see my clients sometimes travel from Philadelphia, sometimes New York City upstate. They love their fancy bird and they spend a lot of money. They do diagnostic tests, and it's a great, I think, the business right now in Pakistan also I see. Okay, my Navly question, just give me 1 second. Okay, guys, can you scan this question and answer? What's the right answer? Raise your hand if you know. And also, Maraj, please give me one favor. We have like a chart section. I tell all the people write on name and everything. Yes.
Sir, you rate option 4.
Why? What is the reason? You know the reason?
सर मोस्टली यूरिक एसिड की वजह से मतलब मेन जो है रीजन इसमें यूरिक एसिड है, उसकी प्रोडक्शन होने की वजह से उसकी एलिमिनेशन नाइट्रोजनियस वेस्ट की नहीं हो सकती, तो उस वजह से ये चांसेस ज्यादा होते हैं.
Dalmatian breed में genetic problem है इसके अंदर. Your answer is right. The point go to you. Okay, your answer is right. Okay.
Yes, sir. You were talking about
when you want to mail the certificate. I know we have like a 566 participate in your group or something like, but you need to get the certificate only who participate this conference. Okay, do not send everyone. Okay, we have all the record, and only the participant student they get all the certificate, not the everyone. Okay, thank you.
Yes, sir. I will make
go
sure.
to the next speaker, our last speaker, I think.
Yes, sir.
Our next guest speaker is Professor Dr. Mazhar Ayaz. Let me introduce him. Parasitology specialist. He had a great experience in parasitology, more than 30 years. From 2018, he is working as a Dean of Faculty of Veterinary Sciences in CUS. He promoted in 2023 as a Pro Vice Chancellor in CUS Bahawalpur. Sir, please, you are welcome. Please start your lecture.
Assalamu alaikum. Good evening, dear colleagues and my respected professor, Dr. Mazhar Iqbal, and my colleagues, Dr. Ijaz Rashid, Dr. Anila, and Dr. Fiaz Kamar, and Dr. Hamad, and my students also. So today we will share about our work in the field of ectoparasites that most of our pets they get, and in this way we will be dealing a great deal about the ectoparasites, that whether we have to control them or manage them or to leave them, this will be our decision. Is this my slide presentation sharing with all?
Yes.
Okay, thank you. So this will be a great topic, and I hope Dr. Ijaz will also second me that due to the less management of ectoparasites by the pet lovers or the owners, the pets also face a lot of diseases. So here we are going that the most of my students and colleagues, they know about the ectoparasites, the parasites which are externally living on the skin or fur of the animals. They can be mostly fleas, ticks, mites, and lice. So the pets, especially dogs and cats, they are equally infected by these parasites, and mostly these parasites do harm and also pose a threat to the one health issues like zoonotic disease also. As the animals face one of the very first disease, that is about the fleas, and you know that on the animals that have fur, these tiny brown colored pests or animals, they live on the skin of dogs and cats, and sometimes they can also infect to the owners also, and they produce itching, and not only itching, they raise their eggs or lay their eggs to the nearby kennels or catteries where these animals can live and give their young ones. If we find a study, talk about the flea biology, so they lay their eggs, then the larva is erupted and pupa, and then adult. In this way, they trigger all these stages nearby or on the host. And as you can see, most of the time scratching your pets. So this can be one of the indication that your pet is infected with fleas. So here is the anatomy of the fleas that can be helpful some way, that you can also help get a help for the identification of the fleas. And they not only pose flea allergy, dermatitis, they also are a threat for the tapeworms, that is Diploidium caninum. So that can also produce some wounds and infections, mostly the pruritus, redness, hair loss, and this can be seen visually. If we talk about the zoonotic of these fleas, So as I talked earlier, they pose a threat to the not only to the dogs and cats, but also to the small children and to the owners of these pets. That is the Diploidium caninum. That, and sometimes these flea also produce a fever-like condition, that is flea-borne typhus, and that is mostly caused by Rickettsia typhi. Or sometimes the cat scratch disease that Professor Dr. Anila has also talked about, analysis. So this can be the one of the threat that the bubonic plague, sometimes it was heard, and in centuries that caused the elimination of mankind from the earth. And that is the oriental rat flea, that is Xenopsula chocosis, and Tinocephalides filus, that can also pose a threat to the bubonic plague, and this can be used sometimes as a warfare. Then comes the ticks. They are blood-sucking, and mostly they can be fatal by producing Rocky Mountain fever, Lyme disease, and dog paralysis, or sometimes they can be also one of the threat for the companions, and not from the dogs and cats, but from the pet goats. They can get Congo fever, and nowadays there are certain reports from Quetta and somewhere from Karachi that people are getting Congo fever. So this can be the one of the most important occasion to warn you people that you must be careful about the tick handling. So ticks, they can be found attached, and they mostly lay their eggs on the host, that is pets, that can be the dog and cat, sometimes in their weddings, and where these dogs and cats are kept, and then they mold, and also they are responsible for anaplasmosis and sometimes babesiosis and ehrlichiosis also in the dogs and cats. So if you see about their life cycle, they give their female give their eggs on the beddings or on the animals where they are mostly not adherent, and then the larva is erupted, then nymph and adult, then they mate again, and in this way they start their cycle, that is one host tick. Sometimes the hosts are changed in one or two, so in that case they can be called as one host ticks, two host ticks, and three host ticks. So namely they can transmit babesiosis even in human beings, and ehrlichiosis in human beings or their owners. Regarding the zoonotic infections, so they can transmit microorganisms, as I mentioned earlier, Babesia, especially Babesia macroti, Borrelia, Rickettsia, Ehrlichia, and same Francisella tularensis and Coxella brontii, and sometimes tick-borne encephalitis virus also in the human population. Then comes the mites. There are several types of mites. They can be air mites, mange mites, sarcoptic mites, demotic mites, and they can attack the dogs and cats. And mostly they live for their several acadiasis, or several their families live there, making burrows in the skin and losing their hairs and itching, sores, and sometimes alopecia and loss of hair also. If the cases are aggravated, then the foul smelling also comes from your animal. The air mites, and always the animal is scratching to the air. Demodex, that can be also sometimes zoonotic and can infect to the human being, sarcoptic mites. They are itch mites and mostly scabies infection in dogs, cats, and human. And if the dogs or cats are roaming in the farms, they can also infect to the horses and cows. So here, if you can see the various pictures of commonly present mites, and their life cycle is also journal, like they lay their eggs in the tunnels or in burrows, and then they erupt as a larvae, then nymph and adult, and then they mate. But there is one thing important, that mostly when there is huddling or the animals get together, these mites have more prevalence, because the temperature and humidity and the huddling of animals contribute them for their production. Here you can see how with the help of otoscope, we can observe the ear mites, and that can be as I told earlier, the situation of the animals can be very poor because they lose their hair, fur, and that is most of the times liked by the peoples and the various fur breeds of pets. Zoonotic infections as acariasis, they can occasionally be transmitted to the humans by incidental contact. And by that, they produce pruritus and dermatitis. The dogs and cats, mice, birds, and reptiles, they harbor several mite species that can be infectious sometimes, but sometimes they are not so infectious. But most of the people, they have so infection with their pets, they may get accidentally. Then is the lice. Lice is very much common. They are host specific. They don't come to the or migrate to the human beings. They mostly live on the dogs and cats. And by regular washing and making them clean, or applying some shampoos, that can be the helpful. The potential of making any disease to their owners is very much limited, and a very less number of papers has described about it. But with the timely management, the lice can be treated with the help of medicated shampoos, topical treatments, and environmental handling. Because sometimes where the animals are living, these lay their eggs, and they are, as Dr. Fiaz Kamar described about nits, they make some their arrangements there for permanent residents. And whenever they get the chance, they come and infect to the animals. There can be the chewing lice, and there can be the biting lice. The chewing lice is called Trichodectus canis, and there is the Heterodexus spinigers. And in the same way, they also look like flecks, like the animal is having some white, something like attached to their body, but they are basically the lice. So the chewing lice or Malophaga and sucking lice or Anoplura, they occur on dogs and cats throughout the world. And similarly, the Linogenethus and Trichodectus, they act as a sucking and chewing lice, because on the dogs, and Pellicula substrata, that is also seen on the dogs and cats. So by infecting these, the human pubic louse, that is Pithrius pubis, that can also be found occasionally on the animals like dogs and cats, which are very near to their owners. So then as the sandflies, they are mostly found in the tropical regions. They are also found in Pakistan, including Multan, and sometimes in KPK and Balochistan. They produce a disease to the animals like dogs and cats and cows or cattle, and to the human beings simultaneously. So they produce anemia, and sometimes kidney failure, skin irritation, and weight loss are some common symptoms. If you see the cases of leishmaniasis, one of the students reported me from Lahore that there was a case, and he very dutifully treated the case of leishmania infinitum in dogs at Lahore. And that is also, they pose a threat to the animals as well as to the human beings. So that is equally transmissible to the owners also. By infected sand flies, they infect to the owners or their skins with leishmania infinitum. And that is mostly called cutaneous leishmaniasis. The other diseases like roundworms or some filariasis, the Thalasia calipeda or eyeworms, and they are sometimes infected to the nearby humans or their owners. Sam, there is very much important disease that is not mostly prevalent in Pakistan or not has been reported even in Pakistan. That is the Diarrhea immitis or parasitic heartworm disease. This is transmitted by the bite of mosquitoes. They transmit filarial worms to the dogs especially, and that pose a threat to the very much precious dogs, and there is no such available treatment except the surgery of that, if timely noted. And if they are given some products like ivermectin, so it can be possibly thought that they can be controlled in very much timely manner. Otherwise, it is very much dangerous for the life of pets, especially dogs, but it is not reported in human beings or in cats. Then filth flies, cockroach, and dung beetles, they do have transmissions in various Scarius species, Trichiurus, Antameba, and Cryptosporidium in the dogs. That is mostly the Trichiurus is mostly transmitted to the human beings, and same about Antameba and Cryptosporidium. But occasionally it has been reported that Scaria can also be accidentally infected to the owners or to the especially young children, that they love the animals, and that is they get the infection in that love. Then there's the Hippobocidi, and their role in the transmission of Bartonella has been reported by various scientists, and they suck the blood of the animals, and they irritate the animals, and every time they don't have attention to their owners and always scratching or removing these Hippobocides. They are very much strong, and they do have very strong bite also. The numerous external parasites, they pose a potential threat to the pet's well-being. It is important to know them and to prevent them. Proactive measures may save your pets from contracting disease caused by these creatures. So know the enemies of your pet's health and get rid of them timely. So here, the Lyme disease, that is also transmitted by the ticks, where the animal gets fever, that a lack of appetite, and there is a stiffness of the body, lethargy, and difficulty in breathing. That is also transmissible to the human beings also. And in 2023, it has been forecasted in the various areas of USA where this can be found. Regarding the treatment, permethrin, lindane, benzyl benzoate, protamidone, sulfur, diclofenac or DDT and ivermectin has been tried, and they are mostly used. So one of the latest drug other than ivermectin, that is the fluralaner, that has recently been reported that prevents various infections, including fleas and ticks around the year. And this is one of the latest research paper which has been published, and that claim that by injecting this medicine, the animals can remain free from these parasites for whole of the year, and that is a good opportunity for the owners as well as for the practitioners to authenticate this study. So here you can like and share my channel also, Veterinary Problems and Solution, for your guidance and for latest. And this is thank you for listening. And now this is the end of my talk, please.
Sir, you have three questions, I'm right?
Okay. Question number 1. What is the cause of heartworm disease? To name the pathogen.
Maraj, can you unmute the first one? Maraj, are you there?
Are they sleeping?
Maraj, who's from the
Dirophilaria immitis.
Very good.
Sir,
okay.
Dirophilaria immitis.
Where are you from?
Islamic University, Bahawalpur.
Okay. Question number 2. What is the latest drug? Name the drug which has ability to cover against the ectoparasites for whole of the year.
Very easy, okay. Maraj, can you Maraj, can you unmute the first one?
Sir, Floranolid. Pronunciation difference.
Okay, no
Where are you from?
Sir, Islamic University, Bahawalpur.
Islamia University, Bahawalpur.
Okay, question number 3. Name the vector of Leishmania infantum. Name the vector of Leishmania infantum.
Sir, sandflies mostly.
Okay, thank you.
Where are you from?
Your
Sir, Islamic University, Bahawalpur. Tanveer Ahmed.
Sir, Mother Yasa, are you there?
yes, sir, I'm here.
Is the answer right or wrong?
Oh, right.
Okay.
Okay, thank you.
Thank you, sir. Thank you very much. And I think all the presentation, they are very, very important. And I think that hopefully you guys have a wonderful time. And where the Maraj?
So we have Dr. Sayyid Salim with us as well. He wanted to present. He was one of the speakers.
Oh, yes, yes. Can you raise his hand? I want to make unmute.
Sir Salim, please raise your hand.
Professor Salim Saab, can you raise your hand? Sir, okay. Did anybody see the name?
No, sir, till not.
Sir, please, can you raise your hand? Professor Salim Saab, if you're listening my voice, can you raise your hand so I can make you co-host? Professor Salim Saab, sir, please, can you raise your hand if you're listening my voice?
जी डॉक्टर साहब वो हमारे पार्टिसिपेंट्स में मौजूद है, मैंने उनसे कहा है कि वो जरा आपको मैसेज करते हैं ताकि आपको पता चल जाए।
उनको प्लीज उनको कह दें कि अपना हाथ रेज करें, मैं उस पे मैं
जी
मुझे मिल नहीं रहा एक्चुअली, कहाँ पर है?
हाँ ये आ गया। ठहर make a co-host. Okay, I just make a co-host.
जी ठीक है, जी लिख दिया मैंने।
जी, our last speaker is like a Professor Salim Saab.
ठीक है, thank you.
I listening their one lecture online, and believe me, I feel that he is the person who knows about like very clinical diagnostic and also the symptom of the pet bird. Very good experience, and I love that presentation when he online, and I hope you guys have a very good presentation about the pet bird. And let's I want to give to the chance for Professor Salim Saab. Please go ahead.
presentation on gallery. Sir, just a minute, please.
Sure.
Download it.
And student, please, Braj, can you write on the name and everything at the end? I want to ask you that, okay? The point and everything.
Yes, sir, I'm doing. Sir, I'm doing.
Sir, मेरी आ रही presentation?
Yes.
Okay.
Yes, sir, we can see.
Bismillahirrahmanirrahim. Thank you very much, Madam Anila. Am I audible?
Yes.
Yes,
Thank
sir.
you, Dr. Ijaz. Sorry, I was a bit late because due to my there was a function in my family. So I will try to give my presentation in time. My topic is bacterial and viral diseases of exotic birds. I am visiting professor at CUS Young, and it is retired from the US. My sequence of slide is steps for assessing the bird's health, sign of disease in birds, how to know that the bird is sick, and how to differentiate between asleep and sick birds, how to handle the problems, medication techniques, detail of common bacterial and viral disease in wild and exotic birds. Actually, I'm just taking the advantage of this forum because I don't get the chance of giving presentation or lecture. So there is very few important topics which is to assess the birds, especially the young veterinarian who are working in the clinic. They used to face this problem, how they can differentiate this bird is sick. So there's a few slides which is not in my topic, basic topic, but I just want to give few times for this important topics. So first is steps to assess the bird's health. It's very important. You just have to examine the droppings. I will give you the detail. Examine bird and its environment, catch bird and start physical examination. Now, droppings. There should be the change in the quantity. You feel there will be change with the quantity of the feces is changed. Increased water components. If you see, there's two types of material in the feces. There's liquid portion and the solid portion. And when you give just put it in the slopey method, the water contents will slope down and the hard content will be left there. If there is a diarrhea, then the hard portion of the feces will also slope, move down toward the downside, which shows that the animal is suffering from diarrhea. Then there is a whole seed pass. It's very important because some birds they don't digest few seeds, so it will come out from the feces as it is. Then dropping stuck on the vent. Then it will be, you can see the vent area. It will be filled with the feces. So if there's a diarrhea, then you can see the feces over there. Then you can see that this is examination. Sorry, from the normal there in the if the feces is normal, this is kidney, ureter, white or creamy paste. It should be creamy and white paste. And then excessive urine. If there's I just mentioned, if there's a problem in the kidney, there will be excessive fluid. Then from intestine, thin coiled tube like varies in colors. Then the color of the feces is very important. If it is black, normal, green, normal, brown, normal, brick red is a normal. These are the normal coloration which you can see in the normal feces. Then there's a dark color or bright color. It is maybe due to toxins, malnutrition, chlamydia, bacterial septicemia, or some viral disease. Then there's a pale color. It may be due to the pancreas or intestine issue. There must be some intestine issue. Now, from the distance examination, it's very important to see from the distance. When you're sitting or standing out of the aviaries, you can see the sign of vomiting, presence of seed husk on the floor, bird eating any one seed rather than mixture, having other food, vegetable, fruits normally, chewing of the wires, any climatic changes. These are the few things which you can see from the physical examination. The normal signs in the bird is very important. All vets should know what are the normal signs. There's a bright alert, both eyes widely open, no discharge or swelling, no stain around the nostril, both nostril open and clean, sitting in normal spots, standing erect. It's very important. The animal will be standing in the erect position. Proper wing in good shape, not folded, not hanging down. It should be folded properly. Then singing actively, no overweight. Then how to differentiate between asleep and sick birds? Sleep when it's their habit. They used to sleep with one legs in the floor and the one legs in the bent. The birds will often sleep with one foot on the perch raised. Will easily aroused by only slight sound. They are very shy. They are very active. When you come near, they will just fly away. So it's a good sign. The tighten its feathers, stretch its wings open, it's widely become an active. Then when you go near to the animal, it will respond very quickly. So the bird is active. The bird is not sick. The sick is the sign which will see the most of the day sleepy, both of the feet on the floor and will be in a crouched position. That you can see the picture, will not easily raised. When you come near to the animal, it will not raise, it will not give any response. After awaking, slightly open eyes, sit quietly. Wing droppings will sit in the unusual location. Normally, every bird they used to sit in the specific location, and your bird owner automatically, if he gives interest to the every, he can easily say that this bird is not healthy because it's not sitting in his normal position. The general sign of it is weight loss, reduction of appetite, head under one wing, sitting low down on the perch, vomiting, flat feather, wet feather around the head, less active than normal, poor responding when go near, cessation of the vocalization, bleeding anywhere. when you see the eyes, there will be discharge. It's very important, especially in the clinics. When you examine, you must see the eyes. There should be some discharge. If there's a discharge, the animal must be sick. Excessive tears, change of color of the eyes, swelling around the eyes, rapidly wiping of the head or ear, eyes on the perch. So these are the signs which you can immediately can say this bird is suffering from any problem. Then there's a nostril. If you watch the nostril, they will be discharged, filled with material. Respiratory tract, this is again very important sign, open mouth breathing. It's very common in the exotic birds. It's during now the winter season coming. There is in any type of respiratory infection, in any upper and lower type, there will be open mouth breathing, then sneezing. Then there is a musculoskeletal neurological signs, balancing problem, inability to perch, rather will sit in the bottom, limping, swollen foot joints. Now, how to handle the problems? Every bird keeper should critically about is management techniques. You must tell him what are the different techniques, what are the different management techniques which you should follow. And this is the duty of as a clinician or the vet. We should give him the solution how to give the proper management. The birds are ill both due to stress. The most important is the bird. Very usually they come in the stress. It's a very common disease. Stress is the main factor. There are so many reasons that may be due to molting periods, breeding season, and when you are moving the birds from one place to another, the animal may come into stress and the change of season. So the season is changing down the birds. There are many cases of the stress coming in the clinic. Then how can I give you the different medication techniques? There are one is crop needle, and then how to give injection and what are the different technique of bird strain. Very quickly, I just show with the pictures. How can you restrain the animal? There are different techniques for the birds like this, as you see the pictures of the different birds. These are the crop needles. It's a very common, very effective and very good techniques for giving medicines or feed in the diseased birds. So it's a very safe method and just very simple technique. You just have to put up from the upper side, and you have to feel the crop when it goes inside, which should be easily palpable. Otherwise, if it is going to trachea, this crop needle will not be palpable. Then there's a different injection sites, just like you see when you are read in the poultry subjects, but it is a bit difficult in the exotic birds like parrots. So you have to be very careful about giving the injection, because the birds, they are very sensitive and they can come into stress due to giving the injection. So better it's a very last option to give the treatment through the injection. This common parrot, Dr. Faiz Kamar Saab has given very elaborated detail of the parrots, which are very common. Now there are few birds which you can say it's a male and female. It's a very important. Being a veterinarian, many people come that is the bird is male or female. So there are different techniques, but by just see, there are few parrots which you can see just by the look. You can say this is a male. Like when you see in the middle picture, there's a budgerigars. The nares, if you see the nares, the male budgie is a darker color, bluish color, that is male. And if it is pink, it is a female. Then there's in the right side, the electus parrot. The male is green and female is always pink. And then it's a very common bird in the raw parrot, Alexandrine. There's a special black marks on the neck. If it is there's a mark that is the male, and if it is a red mark on the shoulder, then it is male, and if it is without any mark, then it is female. And fluid therapy is a very common with the bird animal is very dehydrated. Then you can give this fluid therapy, and mostly it is given in the intraosseous space, yeah, in the subcutaneously. Now coming to my main topic is which are the common diseases. which are present, which we come across in the clinic. The bacterial disease like Staphylococcus, then avian pox virus, Newcastle disease, avian influenza, infectious bronchitis, avian meningotracheitis. Now, common diseases in bird, which is the most common, is diarrhea. As we all know that that is not a disease, it's a symptom. Any disease in which the sign of gastric tract is involved, it results in diarrhea. Here are some, there's a common problems which are the different causes, are like Salmonella and E. coli. Salmonella, gram-negative bacteria, often coliform Salmonella and E. coli. There's a sign, ruffled feather, diarrhea, listlessness, weakness, and shivering, and vent picking. In Salmonella, we can see that their dropping are colored sulfur yellowish green, which is very much diagnostic sign for the microorganisms. And its prevention is just keep water and feed dishes free from fecal material, contact of ivory or birds with outside birds, careful disposal of contaminated material, and minimize stress. Now, avian Salmonella is very common in the poultry, and I've come across many this problem in the parrots and especially the ground birds like pheasants, peacock. So these are very common. And there are three types which are very common: pullurum disease, fowl typhoid, and paratyphoid. In pullurum, their sign will be depression, respiratory distress, loss of appetite, then white diarrhea. White diarrhea is a very common, it is clear-cut symptoms. It can be due to the pullurum disease. Then there's a pot belly. It is very commonly seen in the poultry and in the ground birds. Huddle near heat sources, the animal will be, they will gather near the heat sources. The lesions, if you see in the postmortem lesion, there's grayish white nodes in the heart and gizzard wall. You can see the picture. Grayish white, whitish miliary necrosis in the liver. It's a very clear-cut sign. Urates are often filled with urates, unabsorbed yolk sacs, enlarged spleen, cheesy bacteria in the ceca, peritonitis, ascites, hemorrhagic ovarian follicles. These are the pictures. This is unabsorbed yolk sac. Urates are filled with urates. Ureters are filled with urates. Hemorrhagic ovarian follicles, then peritonitis. Fowl typhoid, again, this is a second type. Fowl typhoid is an infectious disease primarily of chicken and turkeys with many of the clinical epidemiologic features and lesions that occurs with pullurum disease. Signs are nearly the same, just like you have seen the pullurum, and it's very less common in the 1-month-old chicks. Semi-mature and mature birds with fowl typhoid are often have pale head, parrot parts, comb, wattle, and face, shrunken combs and wattles, diarrhea, bright yellow splashes. Somnolence, pale comb and wattle, huddling, diarrhea, and white pasting around vent. You can see the pasting over there. Lesions is enlarged and bronze greenish tint in the liver. Then a biliary necrosis will be found in the liver. The spleen is 2 to 3 times bigger, sometimes grayish whitish nodule. And then enteritis and myocardial necrosis will be found there. Then the third is paratyphoid. It's a fowl paratyphoid is an acute and chronic disease in domestic fowl and many other exotic birds and mammal species, and is caused by motile salmonella serotype that are not host-specific. The highest morbidity and death rates are unusually observed during the first 2 weeks after hatching. The sign is drowsiness, ruffled feather, diarrhea, white pasting around bed, subcutaneous edema in the region of the neck, huddling near the hot heat sources. These are the postmortem lesions: focal necrosis in liver, inflammatory fibrinous exudates in the ceca, unabsorbed yolk sac in the liver, hyperemia, subcapsular hemorrhagics, and dystrophy are detected. Pericarditis and perhepatitis is detected. Inflamed foot pad. So there is a bit confusion in the in bumblefoot. You will also see there's a inflammation of foot pad. So you can see in this salmonella also. Then the treatment is just when on the base of the clinical signs. Oral fluid is a very important, especially when there's a diarrhea. Most commonly, ringer lactate solution is the best. Broad spectrum antibiotic can be given to check because if it is called due to some bacterial infection. Then sulfur drugs is a very good choice kanamycin and gentamicin are usually effective by injection. If necessary, the antibiotic can change after sensitive test results are known. It's my recommendation, if the bird is very expensive, then you must go towards the culture sensitivity. If you do the culture sensitivity, then you can get the very much information that which antibiotic is suitable. Then you can start that antibiotic. That is very important if the bird is expensive. Then water consumption should be monitored. Cetoacidosis, Dr. Faiz Kamal Sahab has defined exactly much about it. The sign is very common and it's a very dangerous because it's a zoonotic nature, and especially in the foreign countries, they are very particular about cetoacidosis. They do give it's a very simple test. Snap test is very common there. Before inviting in the birds in their home, they have to do this snap test, and then they introduce with their other birds. Then so the most common animals are parrots, chicken, turkeys, pigeons, parakeets, cockatiel, ducks. Parrot fever is a rare infection caused by chlamydia psittaci, a specific type of bacteria. In Pakistan, we don't get so much chances of cetoacidosis, but there I have seen few cases. The sign is discharge from the eyes and nose, diarrhea, discolor, droppings, weight loss, lethargy, and sleepiness. The sick bird may eat less or even stop eating completely. Other signs are fever and chills, nausea and vomiting, muscle and joint pain, diarrhea, weakness, fatigue, and cough. These are the picture of the cetoacidosis. Differential diagnosis you can see from the brucellosis, then tularemia, infected enteritis, influenza, tuberculosis, pneumonia, and Q fever. Treatment is the drug of choice is a tetracycline and doxycycline. It's a very the drug of choice, I can say. I use vibramycin, that's a doxycycline, 200 gram per 800 gram per liter water, and it's very effective. So, but you have to give for 45 days at least to just avoid from the bird. It may not become a carrier. So to eliminate completely, we have to give this a long-term treatment. The very young chicks may be treated with azithromycin 40 to 50 mg per kg. After diagnosis, antibiotic treatment typically continue for 10 to 14 days after the fever resolves. Precaution, it's a very important to buy pet birds from reputable pet shop. Wash your hands regularly after handling birds or bird supplies. Avoid touching a bird beak to your mouth. Take birds that look sick to the veterinarian. Keep birds in the well-ventilated area. Avian pox is a very common disease. You can find in the especially pigeons. I've seen many cases in the pigeons and the turkeys and these ground birds. Fowlpox is a slow spreading viral infection. There are two types of cutaneous form and diphtheric form. In cutaneous form, it's just skin involved, and diphtheric form, there's a respiratory tract infection, and one is the systemic form, in which the whole system is involved. It's very dangerous. It's a large DNA virus, avipox virus, and it's a poxvirus family. The virus present in large number in the lesion and is usually transmitted by contact through abrasion of the skin. And this, from the mosquitoes and biting lice, it's biting insects, it's spread from one animal to another. The cutaneous form is just nodules you see on the unfeathered area, feet and legs, and there is a nodule area that enlarge, become yellowish and progressive to thick, dark scab. And it's a very easy, the treatment is very easy. You just scratch it, just remove the scab, and apply some antiseptic over there. And you, for the sake of secondary, to check the secondary infection, you can give the antibiotics. Location, the most dangerous is if there is a lesion around the nasal passage, because the animal will stop, or there will be open mouth breathing, and if it is around the eyes, then the animal the birds will be unable to see to go towards the feed or water. So this is very dangerous. Cutaneous lesion on the eyelids may cause complete closure of the one or both eyes. Only the few birds develop cutaneous lesion. Then there is a diphtheric form. In this, the mouth, pharynx, larynx, and trachea are involved. It's also called wet pox or foul diphtheria. Then caseal patches firmly adhere to the mucosa or larynx and mouth and proliferate masses. They develop mouth lesion interfere with feeding. So the most difficult thing is the animal is unable to take food. Tracheal regions cause difficulty in respiration. You can feel the open mouth breathing over there. Then there are degrees egg production. Cutaneous infection alone only cause low or moderate mortality, and these flocks generally return to normal production after recovery. Diagnosis is, you can see, produce there when the cutaneous infection is there. You can gross and microscopic lesion. You can see physically the pox lesions over there. Then there are different techniques, and fluorescent antibodies techniques. Then you can isolate it from, and then you can do PCR and DNA sequences. You can confirm the diagnosis. The second is a very important, although it's in the poultry, but it is also in the different ground birds. And I have seen many cases in the parrots groups. There are many cases of which may be involved by the Newcastle virus. It's a paramyxo variety family, and there are 3 different types of virulence. So here, one is virulent. This is velogenic. The second is mesogenic, and third is lentogenic. Virulent is velogenic is a very virulent shape. The mesogenic is less, and the lentogenic is very, very low virulent. So I skip. Now, morbidity is up to 100%. Mortality is 90%. Varies greatly depending on the virulence of strains. Then it depends upon the environment condition, vaccine history, and some species show few or no sign, but they are in the carrier state. They are very dangerous. Direct transmission is through direct contact with feces, respiratory secretions, indirect contact through feed, water, equipment, human clothing, contaminated or incomplete inactivated vaccines through these can be spread. Animal transmission is survival for long period in the environment. Virus shed during the incubation period for a long short time during recovery. Incubation is 2 to 15 days, 5 to 6 days average. Migratory birds, feral pigeons, they are very much prone to this infection. Clinical sign: drop in egg production, numerous deaths within 24 to 48 hours. Death continues for 7 to 10 days, and surviving birds may have neurological or reproductive damage. You can see the pictures. Many cases like this come in the clinic. Their head, they're tilted towards upside. Then edema head, especially around the eyes, greenish dark watery diarrhea, respiratory and neurological signs. Then tremor, dropping eggs, dragging legs, twisting of the head and neck, circling depression in the appetence, and complete paralysis. Then signs vary with the species and virulence. Then there is a respiratory sign like gasping, coughing, sneezing, and rales. Then nervous sign is tremor, paralysis, wing and leg twisted neck, circling, chronic spasm, complete paralysis. The respiratory sign in neurotropic virogenic disease. Then there in the pigeons, you can see there's a nervous signs and diarrhea. This is the same. There's one few things is important, that the egg may be abnormal in color and shape in this disease. Mortality, again, I've just mentioned earlier. So poorly vaccinated bird may develop torticollis, ataxia, and bird head tremor 10 to 14 days after infection and may recover with supportive care. This is the typical pictures of ND. Postmortem lesions, just like we have read in the poultry, edema of head, neck, edema, hemorrhagic necrosis, alteration of lymphoid tissues, hemorrhagic in tracheal mucosa, proventriculus, intestinal mucosa. Clinical signs: sudden decrease in egg production, high morbidity and mortality. Characteristic signs are gross lesions. Is a laboratory diagnosed through virus isolation, again PCR, do serology, different strain method, and the other one is avian influenza. It's a very common disease, avian influenza, in the domestic poultry and pet, zoo, and wild birds. In domestic poultry, AI, and avian influenza virus are typically of low pathogenicity, causing subclinical infection, respiratory disease, or drop in egg production. However, in few avian influenza virus cause severe systemic infection with high mortality. This highly pathogenic form of the disease has historically been called foul plague. This is it's a worldwide distribution. HPV viruses arises from mutation of some H5 and H7 low pathogenic viruses and cause devastating epidemic. Avian influenza, this is highly variable and clinical sign. In the low pathogenicity avian influenza, respiratory signs such as sneezing, coughing, ocular and nasal discharge, and swollen infraorbital sinuses and poultry sinuses. Sinusitis is common in domestic ducks, quail, and turkeys, and especially I must mention in the gray parrot. I have seen many cases like there's an inflammation of the sinuses. So this is very common in the gray parrot. So it might be due to the avian influenza. So sinusitis is common, and the lesion in the respiratory tract typically include congestion and inflammation of trachea and lungs. If we're talking about the layers and breeders, just like the poultry, decrease egg production and the over ruptures of it, then a few layer and breeder chicken may have an acute renal failure and visceral urates, deposits, visceral gout also is a complication can comes when there is a visceral gouts. The morbidity and mortality is usually low unless accompanied by secondary bacterial infection. And if there's no bacterial infection, then the mortality rate is very low. High pathogen avian influenza virus per acute cases, clinical signs and gross lesion may be lacking of before death. However, in acute cases, lesion may include cyanosis and edema of the head, comb, wattle, and snoot. Edema and red crystallization of shank and due to subcutaneous ecchymotic hemorrhages. You can see the picture. It's very commonly you see this type of cases comes. Particular hemorrhage on the visceral organ and in the muscles and blood tinged area and nasal discharges and severe hepatic drainage diarrhea. And if there's a problem in the CNS, then torticollis epistonesis, incoordination, paralysis, and drooping bones. Then the location and severity of micro lesions are highly variable and consist of edema, hemorrhages, and necrosis in the parenchymal cell of the multiple visceral organ like skin and CNS problem. Diagnosis is again simply through different, which I've just mentioned earlier, through taking the swabs and isolation of the virus and then PCR test. Prevention is vaccine, then treatment with the broad spectrum antibiotic you can give to just check the secondary infection. It's zoonotic. Due to zoonotic nature, it's very important that we have to take some precautions to direct contact with the live or dead fetus infected poultry, but few cases have resulted from consumption of uncooked poultry products, defeathering of infected wild swans, and close contact with the human cases. Respiratory infection has been the most frequent presentation of human H5N1 cases. Then the infectious bronchitis is acute, highly contagious viral respiratory disease. Tracheal rales, coughing, sneezing, handle cuts, these are the very common signs which are found, and there's a decrease in egg production. This is a coronavirus, the cause. Clinical signs appear within 36 to 48 hours. The signs vary in different age group. Young chicks, highly susceptible, gasping, distress breathing, tracheal rales, sneezing, cough, open mouth breathing, depressed, and huddled together. Mortality morbidity is 25 to 30%. Very young chicks, damage to oviduct, and a typical sign. There's a you can see. Then these are this is the typical sign. The inferior quality of eggs. You can see misshaped or thin-shelled eggs will be there. These are the pictures of the eggs suffering from the infectious bronchitis. So there's a graph. Is it there? If they are involved with the there's a low production, comparison of percentage of poor quality with. Then postmortem catarrh cases exudates in the upper respiratory tracts. Cases plugs may be found in the trachea. You can see the picture. Cloudy air sacs, atrophied oviduct, abdominal air sacs may contain yellow caseous exudates, occasionally swollen and pale kidneys containing urolithes deposits. These are the pictures. You can see swollen pale kidneys. Diagnosis is the same as virus isolation, and these are different techniques you can confirm through ELISA test or PCR test. So you can confirm this. These are the 18-day early OSD treatment. There is no treatment. Provide additional heat, antibiotics, and there's a vaccine very commonly available for this.
Yeah, 145, right? Okay.
So these were the main diseases which I've just mentioned, and there's many list of bacterial and viral diseases, but I just want to give this few diseases. Thank you very much.
Thank you, sir. Sir, you have 3 questions for the student.
So, okay, my first question is, what are the different types of salmonellosis I just mentioned in the presentation?
Please raise your hand. Okay. Who's from the Vet Crescent Society? After Maraj. Can you unmute the first one?
Tanveer Ahmad, please speak. Jahazeb Heather, please unmute yourself.
So typhoid and paratyphoid and there was a one, but I can't remember it. 2 of the one I can recall it.
Can you repeat it?
Fizak Bal, please continue from here. Fizak Bal, are you listening?
Okay.
I
Yes,
just
please
mentioned
continue.
3 types.
Can you unmute the first one? We don't have that one.
Okay, sir. Asadullah Qureja.
Sir, it's a paratyphoid, foul typhoid, and polarum disease.
Okay, right answer.
Okay, which university from you?
Sir, from Sindh Agriculture University, Tandojam, Hyderabad, Sindh.
Okay, Fiza, can you write on the name and also university?
Okay. My second question is, can anyone tell what are the 3 basic symptoms of the sick birds?
Please raise your hand. Fiza, can you open the first one?
Okay, sir. Rania Zahra.
Okay. Please, can you speak?
Assalamu alaikum. Rania Zahra from Rifa International University. Sick birds have signs like most of the day sleepy. He will sit quietly or wing dropping and not easily raised.
Okay, right answer.
Okay, sir. Third question, yeah.
Third question, what are the different types of ND I just mentioned? Different types of ND.
Muhammad Jamshed, you can answer.
Assalamualaikum. This is Muhammad Jamshed. The 3 types of lantogenic, mesogenic, and velogenic.
Which university from?
Rifa International University. RIU.
Right answer. Thank you.
Okay, thank
Welcome,
you.
sir.
Thank you, sir. Thank you. So, Fiza, last, please, can you nominate like who give the most correct answer, which university student? I believe the Rafa or maybe Islamia
Yes,
University.
sir. Rifa University from Muhammad Jamshed.
Fiza, can you okay, we done with the question answer session. Can you announce
Okay,
like
sir.
it? Can you announce like it, which university student give most correct answer?
Sir,
Sir, this
Rifa
is
University.
Jahzeb Haider from Rifa International University.
Jahzeb, we done with the question answer. Please, can you unmute your phone? Okay. Let's speak with the Fiza. Okay, from the Vet Crescent Society. Okay. Hello.
Yes, sir.
Yes.
Yes, sir.
You have the list. Like I told the guy, you guys make a list. You know the which university give the most correct answer.
Okay, sir. I'll tell you. Sir, it's Rifa University, Jahzeb Haider.
Yes.
Rifa International University.
So Rafa International University, they answer like a 4 question. I'm right? 4 or 5.
Yes, sir.
Who's the second one?
Okay, sir. I'll tell you.
The second one is Islamia University, Bawalpur. Tanveer Ahmed. He answered 4 questions, 3 right, 1 wrong. Am I right? I wish UVAS also have some like get more point, but unfortunately, I think the UVAS student at this point, I don't want to say this thing, but very disappointed. Okay. I don't know what's the reason. I have no idea, no clue. Okay. And one thing I'm telling you truth, no professor disclose any question to anyone. Even Dr. Mazhar Saab, Professor Saab, the student who answered the question is outside from the Rafa. And the Rafa University get the point from the different speaker, other university. So I think this is a very healthy competition. And I appreciate everyone. And especially I will thank Professor Dr. Mazhar Saab, who stay with us still. I see his videos on, and my classmate Dr. Himasa, Professor Faiz Kamar Saab, Professor Anila Durrani Saab, and Professor Salim Saab. At the end, I would like to say, give to the mic Professor Dr. Anila Durrani. Before I give the mic to Professor Dr. Anila Durrani, I want to say one thing. Professor Mazhar Ijaz, they explain about the heartworm disease. Let me tell you one thing. In USA, this is a huge market for that to prevent like a flea and tick. We have a lot of medicine. We have rule and regulation also for the heartworm disease. And in the cat, there's one board question in the cat. When the cat become like a heartworm disease positive, there's any treatment available. There's no treatment available in the cat, but the cat still survive 5 years. If you give any treatment to kill that microflaria, the cat will also die due to the anaphylactic shock. In the dog, we have a treatment. We have very good treatment. I think the Professor Mazhar Ijaz said there's no treatment, but we have very good treatment. Does not need to remove with the surgical. Right now we have injection, a metasite. We give like a, we follow like a UPenn protocol, one injection, and after like a 28 days, we give second, and next day we get third injection. This we call like a slow killing. If we give like a fast, sometime to the anaphylactic shock, the dog can die. So that's very important thing. And also with ectoparasite, there's also very big market in USA. And vaccination, oh my goodness, is very big market, and also the practitioner also make a lot of money with the vaccination also. And the bone plating is very good presentation, and I think the time is very limited, subject is very vast, and maybe I will maybe next time I think we will have another conference with the Professor Dr. Mazhar, and hopefully you guys have a wonderful time. And the next one thing, the last and least, I want to say one thing. We have a participant like a 566 enrolled in the group, but only 200 show up, or maybe 200, maybe 210 or something like. And this is not a very good indication. Believe me, in USA, when I was in University of Missouri, Columbia, we have a professor. They're working on Sunday also with us, okay. We go for surgery, like 150 surgery. Every student have to do like maybe 10, 12 surgery. And the professor, they're loading, unloading truck with us. They are so dedicated also. And the same dedication I see in Pakistan also. Our professor, they are very dedicated, but our student, unfortunately, I see very disappointed, okay. Only few of students, they have very interest, but our student, in Pakistan student, they want everything, but they want somebody, maybe they are thinking, their thought is that even they don't want to put the food in the mouth. They will, somebody want to maybe put the food in their mouth. That does not work in new world right now. Everyone have to work hard, very struggle. Otherwise, if you say that you want to become like a very good doctor, very good veterinarian, you have to learn latest technique, all these things. That's why we arrange this conference, and why we are wasting my time, why we are wasting my professor time, for simply for you guys are. If you are not coming, then it is useless for us, and for my professor, all they are wasting their time then. This is a conference we holding for you, not for me, not for the professor. They know everything already, okay. Please try to understand and give that time. And the participant who attend this conference, I really appreciate them, and hopefully you have wonderful time. I give to the mic to the Professor Dr. Neela Dhroni. Thank you.
Thank you so much, sir. I really appreciate your efforts and your patience in holding this event. And I'm also thankful to Dr. Mazhar Sahab. I'm honored in his presence. I have given my presentation, and we are all his students, and we all seek advice from him. All the students are very lucky because Mazhar Sahab is giving time to all of us. And you are giving your time out of your busy schedule as well. But we must realize that all these events are organized for the students, by the students. We are standing with the students, but sometimes it is very disappointing to see the outcomes are not as we expect. But even I have seen a change in the behavior of students in this Zoom meeting. So they kept on answering the questions, and few of them were very showed their interest actually. And I have seen a change in the behavior of students. So I am very positive about them. Yes, we need to tell them again and again. We need to motivate them. We need to guide them. We need to tell their mistakes as well. And I am hopeful that in the next session, they will just realize the importance of all these educational activities, and the efforts that are behind these educational activities are a lot of them. I also appreciate the working of students of RIFA and Veterinary Sciences Society working together with each other. This is another positive approach that I have seen. Then I have also seen the keenness of students in answering the questions, and RIFA students, they turned out to be good in this, and I appreciate their efforts as well. My prayers for all of you, and I really appreciate Dr. Ijaz Rashid for his time, his patience, his efforts, and I can see the pain in you, sir. So we are with you, and we will always be with you. We all are together because we want to see a better future for veterinarians in our country. Thank you so much.
Anyone else want to say anything?
Dr. Ijaz Rashid, can you listen to me?
Yes, sir.
Yeah, well, it was a really very, very informative session. And I also enjoyed very much. I got a lot of knowledge from this session. However, I will like to have one comment. I was told that every speaker will be given 25 minutes. So I think, that may be one of the reasons that the students, some of the students left during the session because it was such a long session. So in future, I think if we restrict to the time limit, that will be much better. The students will not lose interest in the talks. But I have seen, some of the speakers, they took more than 1 hour even. I tried to finish in 25 minutes and I summarized all the, procedure of bone plating. Otherwise, I could also go beyond 1 hour. But I thought, maybe, we should stick to the time limit. That's one of my comments, if you don't mind it.
No, sir, you are actually right. You are actually right. I'm sorry for say, but next time, yes, of course, we have to be time, and also we need to select because this is a very vast subject like a bone plating. And sorry, where you summarize, unbelievable. And I hope the student will love it and like it, and we all your student. And most of that thing in this conference, they are your student, and we feel like a proud and player that you are with us. Dr. Hamad, you want to say anything?
Thank you very much. Thank you, Doctor. You always give me great tributes. Thank you so much for that.
Thank you, sir. Dr. Hamad, you want to say anything?
बहुत शुक्रिया. Thank you very much, Dr. Ijaz. I'm really feeling myself proud that I gave my presentation when my professor is sitting with us, Sir Mazhar. Sir, thank you very much. Really, I am honored and humbled. And Dr. Ijaz, really thankful to you for arranging such a event. I'm thankful to Dr. Anila, Dr. Mazhar, and all the participants as a speaker, and the students who remained with us up till now. Still, the number is good, although it's 1/5 of the strength which is with us at the moment, but still I'm not hopeless. Next time, inshallah, we will have good number, and as Sir Mazhar has identified, inshallah, we all will adhere to the time as well. And next time, sir, please keep some bell that after 15 minutes it should ring once, and at 18 minutes again it should ring, and at 20 minutes the final time. So everybody should sum up within time.
Yes.
Thank you very much. Thanks again for providing us this opportunity to interact with the students and to be with our teacher and colleagues. Thank you. Thank you again.
The FISA, the Vet Care Society, you are here? Okay, I think everybody left right now. Okay, thank you, everyone. Let me close the meeting, okay? Thank you.